People should be coming into the webinar now. Yep. Good, take it away.
Right on. I'm wondering if I should do a mic check since you guys can see the folks, or should I pull it up on my computer to be able to see? Can everybody hear me okay?
Tim, can you hear us?
Oh, we got Tim.
Yeah, I can hear you. Can you hear me?
Gotcha. And Julie's there too.
Great.
All right, everybody and anybody from the community that's joining, welcome to our Ag Behavioral Working Group in-person hybrid meeting down at CSU Pueblo. Thanks for joining. I'm hearing myself behind me. It's always an uncomfortable thing to hear how you feel in your ears outside of your head. Sounded weird. Anyway, I'll keep going. Thanks for joining. For those of you who are joining us online, we won't be able to see you, your picture, but you are welcome to interact at any point. And we should, Robert, do we have Spanish interpretation set up?
Yes. Yeah. You ready for that?
Ready for that? We will have Spanish interpretation and wait for the big reveal to see who will be interpreting for us. Hopefully they will be able to log on.
I am here already.
Welcome. All right, I'm gonna let you introduce folks, Consuelo, and we'll take a moment.
Hola, muy buenos días. Mi nombre es Consuelo. Voy a ser la intérprete de español para esta reunión. Voy a estar interpretando simultáneamente. Para ello necesitan, por favor, elegir el símbolo de interpretación. Cuando inicien la interpretación, ustedes van a ver un globo en la parte baja de su pantalla. Por favor, seleccionen ese. Después de ello, elijan del menú. Van a ver en el menú que va a decir Spanish. Y si quieren escuchar únicamente en español, también den clic en Mute Original Audio. Si necesitan inglés, únicamente van a escuchar inglés. Y después de eso ya nada más presionen Done y va a escuchar la interpretación en español. Muchísimas gracias. Thank you so much.
Thank you, Consuelo. And again, for the general public that's joining us, that's not on the screen, there's a question and answer function in the bottom of your Zoom window that you can ask questions at any time during the meeting, and Robert or Rosie will be able to pass that on to us. There's also an opportunity for you to submit any written comments as well. If anything comes up, you'd like to share something, feel free to do so. Next, we're going to just go around and introduce the folks that are here. We might be having a few folks that continue to join us online. It looks like that we're a little bit light. I think that there's a total of up to 18 of us that could be present, but for now we'll start with the people in the room doing introductions, and then maybe move to folks online in case anybody else is able to join us. So my request would be that you just state your name, your location where you live, and if you want to state what your role is and why you are a part of this meeting today, you can do that. And then maybe something that's surprising about you personally, or something fun about your summer. I'm looking at Katherine because she just has something fun to share. Yeah, so my name's Clinton Wilson. I work for CSU with the Agribility program, and I oversee the behavioral health logistics for the state program here in Colorado through CSU Extension. And something surprising about me is I have a 3-year-old Kuni pig that I got back when she was a month old with her sister. And I don't think this is offensive, but we raised her to be meat. And when she was, usually it's about a 24-ish month to full size. When she was about 13 months, she got really sick and wouldn't get up. And we knew that she was going to not make it. And so we went out, we took care of her. We were feeding her apple cider vinegar and honey tincture that our pig friends had, our friends that grow pigs, had recommended, us do to try and nurse her back. And, for 3 days, she didn't get up. And on the third day, I went out to the barn and she was up and running around. And my family, when it came slaughter time, they were like, we can't eat Petunia. We just spent all this time saving her life. How can we? So anyway, so I have a, now 3.5-year-old, really large cooney pig on our farm that we weren't expecting to have. So with that, I'm going to pass it to my right to JC, but the one thing I'll say is that we do have some special guests with us today here at CSU Pueblo, and I've invited them to just introduce themselves and be a part of this first part of our meeting. So if you recognize some people that are not normally on the behavioral health working group, they are guests that we have joining just today, and I'll let them introduce themselves when we get to you. So, but I'll pass to JC, which most of you know.
That's a tough story to follow.
I'm sure that after 20-something years, you can do it.
JC Carrica, literally in transition today. I will be finishing working for Valleywide Health Systems in La Junta at noon. And then at noon, I head to Durango and start with Access. So I will be here till noon. I have to be in Durango by 5 so I can get my Access card to report to work at 8 in the morning. So glad to be here. Plan on staying on the committee. Excited about what this group does. Something surprising about me, not nearly as fun, but surprising maybe, I'm an alum. University of Southern Colorado alum, 1996. They changed the name about 2 years later. In fact, all of my family are alum of this institution through different names. Got cantaloupe here on the way out. If anybody wants Rocky Ford cantaloupe from Knapp Farms. Next time I'll make sure to bring Proctor Farms cantaloupe.
Yeah.
That's family as well, so I'm trying to do both sides. And we have a proctor on this committee, so important to keep that in mind. That's me.
Tony House, Los Animas County Commissioner, President-elect of Colorado Counties Incorporated, and been an avid mental health advocate for many years. First with the safety trailer at the Colorado Farm Bureau. That was one of the projects that I introduced, and near and dear to my heart.
I'm Jacob Walter. I work here at CSU Pueblo with all of our satellite campuses across the state and our outreach and our academic and industry partnerships, all those kind of buckets. I am on this committee as from an ag perspective and from our family having experiences with mental health as well. Fun fact about me is that we actually, Tony and I, our families lived about a mile away from each other across the canyon and then moved apart. I'm in Fowler now and he's down by Trinidad. But his wife was actually my math teacher. Now her and I serve on a different state board together. So we go way back.
Yes.
Awesome.
My name is Julie Drake and I work for Pueblo Community Health Center. I work in behavioral health and I am kind of an old dog social worker. I've been around for about 40 years in Pueblo. And so I'm really happy to join the group. Thank you for the invite to do that. So I think I'll be presenting a little bit later about the Community Health Center. And a fun fact, I'm not sure that it's real fun, but I am starting a business for floral design. So I love flowers, I love growing, I love everything about agriculture. And so I will be starting my own floral business, maybe in retirement. So that's a very special fact.
Congratulations.
Cool. So I think I qualify as a guest participant because I'm not really on your working group, but I'm a dear friend of Robert Sakata, so I couldn't pass up the opportunity. It was so close. So Matt Heinrich, we have a multi-generational irrigated family farm in Crowley, which is just to the east of us right here, about 45-50 miles. I don't know, maybe a lot of people probably don't know this. Not a native Coloradan, actually grew up in not right outside of New York City and was raised in a suburb. And the only farming I did was a bad job of keeping my the lawn mowed. In our house. So it's been kind of a journey, but we've been here in Colorado since 1987. My wife's family's from here.
Well, good morning, everybody. My name is Kristyn White Davis. I'm the Vice President of Enrollment Management at CSU Pueblo. And Jacob works with me. And I am so happy to have you all here today. I guess I'll do a little more formal thing in a minute, but I guess fun fact, maybe I'll tattle on myself. I just told Jacob a funny story that my 5-year-old who I'm from rural New Mexico, kind of almost by the panhandle. And pretty recently I was out in the county of Pueblo with my 5-year-old, and he asked me what these big tall stacks were. And I said, oh, those are corn rows. And he said, corn doesn't grow on trees. And I felt my grandpa just almost for heaven. So that's real. So I'm gonna have to take him out to get some more accounting experience, I suppose, and get that kid out of the city. So but I'm really grateful for the work that you are all doing, and I look forward to kind of getting to talk a little bit more shortly. Thanks.
Hey, everybody, Robert Sakata, Sakata Farms in Brighton, Colorado, and serving as the Ag Water Policy Advisor at the Department of Ag. It's a real pleasure to be a part of this process, and we're excited that the Department of Ag can be engaged in this really important discussion. So I'm just thrilled to be here, being the Water Policy Advisor. Matt, you'd appreciate this. I tell people that the reason I'm engaged in this is because water drives us crazy. Right? So.
Been known to.
Yeah. So, but I think the fun fact about me is that, unlike Matt, I grew up on the farm, so I knew better and I didn't want to strike the farm.
Don't do that.
Yeah. So when I graduated high school, I went to the other school. I did not go to CSU. My parents were so supportive, but I studied molecular cellular developmental biology with a minor in child psychology, and actually was doing DNA research way back then. This was really exciting. So, cool. And sent over my partner, right?
My name is Rosie Skovron. I work in the Drought and Climate Resilience Office at the Colorado Department of Agriculture. And so Robert and I both kind of leave our regular daily duties to help with this work group. And I've really enjoyed getting to meet everyone on this work group and learn about what's going on with rural mental health in our state. I guess similar to Robert's fun fact is that I studied anthropology in college, and I'm from outside of Seattle, and my capstone project was studying the impact of climate change on salmon populations in Alaska. So a very circuitous route to get here. But I worked on some farms in Boulder County, and that's what brought me to the Department of Ag. So very glad to be here.
Hi, everyone. Katherine Harvey. I'm the Rural Strategies Specialist with the Office of Suicide Prevention. So we're housed under the Colorado Department of Public Health and Environment. I always have to take a breath to say that. My background is I grew up as a lifelong rural resident. I still live in Gilpin County, which is I'm 10 miles away from Blackhawk in Central City. So more up in the mountains. Did not have, was not around ag growing up, but still had donkeys and horses and chickens. So we had an itty bitty baby ranch basically. And I think my fun fact was sort of determined already for me. I just got back a week and a half ago from 3 weeks in Mongolia, and I was horsepacking in Western Mongolia and still reacclimating to being around a bunch of other human beings and not horses. So thanks for having me.
Thanks, Catherine. That's so cool. My name is Chad Reznicek. I'm the Behavioral Health State Specialist with CSU Extension and the Colorado Agribuilding Project. And I grew up in central Nebraska. Both my parents were raised on farms, chose out farm work themselves, but I was able to provide very unskilled but affordable labor to my grandparents growing up. So became a therapist, worked in mental health about 20 years, and was able to join CSU Extension. So honored to be here and be part of this work. Not a super fun fact, but one that I'll share is that my last name Reznicek means little butcher in Czechoslovakian. And I am 52, and I learned this about 3 years ago from some random guy behind a desk when I was spelling my name for him. He's like, you know that means little butcher in Czechoslovakian? First I've heard of it. So and I was like, hey, does our last name mean little butcher? He's like, yeah. Thanks, Dad.
Awesome. All right, we're gonna bounce over to Tim and Julie. Tim, I'll pick on you first, and then Julie, you can go next.
It sounds good. Thank you. Tim Miller, Colorado Farm Bureau. I grew up in Minnesota. I've been in Colorado for just almost 11 years now, I guess. Time does fly. Got involved with this. You know, I have a passion for it. In a past life, I was a lobbyist for the American Psychiatric Association, and so got to work in the mental health realm and that, and saw a nice opportunity to continue doing that work when I started with Farm Bureau about a year ago. And I guess a fun fact about me, it has been a year since I worked here, but today is the 75th anniversary of the Colorado Farm Bureau. And so I'm in the office today. There's a lot going on. And yeah, it's exciting around here. I'm gonna have to jump off at about 11 for a little bit they're doing a presentation, and our board is here today, and a lot going on. So, but I hope to jump back on after lunch, just to kind of let the group know on that.
Awesome. Thanks for joining us this morning, Tim. That does sound like a big day. 75 years is a good marker.
Yeah, sure is.
All right, Julie.
Julie Elliott, Behavioral Health Specialist for CSU in the Agribility Program. I'm actually located in Western Colorado in Grand Junction. I cover the western part of the state. Grew up 6th generation cattle ranch family, grew up in Northwest Colorado. And fun fact, I don't know if it's fun, but I used to teach high school and middle school, and when I would do that during the summer vacations, I would take my father's sheep camp and a bunch of sheep and go out to our summer pastures, and I would spend at least a month just kind of debriefing, recovering from the school year, whatever. Had more fun, and I really miss that opportunity of doing that now because it was just really fun. Wouldn't see anyone for a month. Of course, no one would want to see me after a month either, kind of thing. But yeah, lots of fun. Arrowhead hunting, lots of reading, and things like that. So it was fun. Not everyone wants to live in a sheep wagon.
Man, that was good. I worked with Julie and I never heard that. I'm excited to know that, Julie. I would like to go and take the sheep out to pasture for a month. Okay, thanks everybody. Glad you could all be here to join us. I'm gonna pass it back over to Dr. Kristyn White to welcome us and give us a little bit more details about CSU Pueblo or where we are.
Well, I appreciate being invited. Thank you all for having me today. I guess I just have to say thank you for the work you're doing. I just am really, really grateful that there are so many advocates and across our state in different counties who both online and in person are coming together to really propel the conversation about behavioral health forward and how important it is. And it feels inspiring, and maybe that sounds cliche to say, but I think we underestimate how important it is to get people across the room from different places sort of having collective conversations about maybe what is seen as isolated experiences, but may not be so isolated. So thank you for what you're doing. Our farmers and ranchers contribute so much to our state and to our nation, and your advocacy on their behalf and thinking about how we make sure and take care of people everywhere is so important. I would like to share that at CSU Pueblo, we are designated by the state as a healthy-minded, hunger-free campus, and I think that's something we're really, really proud of. Given that our student population does experience, food insecurity and does uniquely have mental health challenges sort of flushed upon them. Maybe that's everywhere, but I think we're trying really hard to think about how we can provide support for our students. And that starts with our packed pantry, which we have downstairs. If you get bored and want a tour, I'm sure there's someone down there. The students can go down there and get the food they need, and it gets delivered every week. And also we have our free counseling services for our students, and that's also a really neat feature that our students get to benefit from when they're here, and that's over in our nursing school, but I'm appreciative of you being here, and I know many of you, if you work at CSU, you know that the Board of Governors has made a mental health sort of for our student and our campuses a super priority, and so it feels important to me to be a part of a larger state system effort to sort of say, like, this is important. Mental health is a priority for our state and for our institutions. So I'm glad you're here, and I hope you have a wonderful day. And it looks like it's going to be great weather, even though you don't have any windows in here. So, but if you get a chance to go downstairs and enjoy it, it's not supposed to rain till this evening. So hope you have a great day. Thanks for having me.
Thanks, Dr. White. Robert,
I have a question for you. I hope you don't mind.
No, not at all.
How are students recovering from the COVID incident? I mean, that must have been so challenging for students to go through that.
I mean, I think it's, it's just little bits at a time, right? I mean, the hardest part is, I think, from my perspective, is the students that we lost, that they became like disenfranchised with everything, and we can't get to them, right? I think the students who've come back are seeing the support services that they, through either advising, through student affairs, activities, through just connecting to their peers again. I think they're getting some support, or the support we hope that they need, or at least they're asking for support, right? It is hard to measure that group that we know we lost, and we're just trying to go back to get them. So we're working really diligently to keep as many of our continuing students forward. I think CSU Pueblo has really worked hard in student affairs to sort of reorg to kind of create like we have our student advocacy center and a PAC, we call it our PAC cares team. And so there's a whole group that meet every week to sort of identify students that are maybe displaying characteristics of and anyone can put an anonymous PAC cares concern in. And so it could be a faculty member, a student displayed someone being upset. I saw a student in financial aid just kind of in tears one day, and so the financial aid director went out and sat with that student for a minute. But then, what was sort of financial overwhelm, right? But then we also, that got put in PAC cares, and so there were other things happening in that student. So this group of colleagues on campus sort of kind of triage as much as we can when we kind of get a case, sort of a case management style. So I think, we're trying to do it, almost like I always get kind of teased, but like one starfish at a time. You just got to throw them back in the ocean.
yeah.
And kind of then keep them there as much as you can. So
I think I give you credit because I think smaller campuses like that can really have the advantage over being able to do that. Going to the school in Boulder where it was so huge, where you really felt like a number, walking into a lecture hall of 600 people, you kind of got lost. So
I say this, so I also am a CU alum. I know I always touchy.
Exactly. It's very touching.
But I remember once as a student, not even, it was probably 25 stairs, 600 students in a room in my anthropology class, actually. And I remember not seeing some schedule thing that wouldn't work for my life. And it never even occurred to me as a student to just walk the steps down to ask for, it was I just rearranged my personal life to accommodate this schedule, because it didn't seem like a thing I could just go. And the faculty member or the TA or whoever, would have probably been yeah, no problem, man, just do that, but I wouldn't have even, did not occur to me that it was an option to ask for, can I take the test early? Right? That just didn't happen to me. And I think more and more, how do we build support structures where students will just say, hey, can I do this on Wednesday? Can I raise my hand? I lost the book. I'm hungry. I mean, how do we build capacity for those kinds of interactions so that people know it's okay to ask? Because I didn't know.
Yeah.
So if it makes you feel any better, the ACT kids are going to see you now on CSU. So you don't have to defend yourself anymore. I know of two that are going to see you for.
CSU is a great school. CSU is a great school. We moved to Colorado and I wanted to get far away from my family, and now, I live back basically 2 miles away, because, you go away to come back, I guess.
Plus at CU, what we're trying to do is make corn grow on trees.
That's awesome. Well, thanks, Dr. White. And also, Julie Drake has joined us from here in the Pueblo area as well. Julie, can you tell us a little bit about what you do and your connection with behavioral health?
Yes, I will. Thank you. like I said, I'm Julie Drake and I work in behavioral health for Pueblo Community Health Center. We're a large community health center. Obviously, we have 25,000 patients that we serve. And we have special programs, and I'll talk about those. But we are an integrated model for healthcare. So integration meaning primary care, mental health care, behavioral health. We have dental care, we have pharmacy, we have all kinds of services all in one stop for our patients. You know, I work in behavioral health, so I'm one of the managers in behavioral health, and we run not only therapy, we run groups for people to be into therapy and be connected. As part of mental health, we also have the medicated treatment assistance program for people that have drug and alcohol difficulties and want to get off of drugs and alcohol. Then we have like our programs for that, and our doctors are on board with that, and our therapists are on board with that as well for treatment. So we have special populations of people that we help. Migrant seasonal farm workers are that one of those populations. Our homeless population is another population that we get grants for, and also our HIV and AIDS patients. We are the leading specialist for HIV and AIDS treatment in all of Southern Colorado. So we do that treatment from the New Mexico border to the Kansas border. They can come to us for treatment. And our doctor is fabulous. He is going to be retiring, so we have another person that's going to be taking over that program as well. But we get funding for those special population programs. But our migrant seasonal farm worker program is something that we're very focused on and want to have more involvement from farmers in our community and our patients. So we have about 13 different locations in Pueblo, and one of them is in the Avondale area for our farm workers so that they can easily access care without coming into town for that. We have a large community center that's on Colorado Avenue, which is centrally located in Pueblo. And we have another one on the east side of town that we have just built. It's a beautiful facility. So if anybody ever wants a tour of any of the facilities, I'd be glad to do that for you. I did bring some brochures for you so that you have that. We have sliding fee programs, and we take all insurances. Our biggest payers are Medicaid, Medicare, but we take all different insurances, and if people are underinsured or not insured, we help them get connected to insurance if we can, and if not, we have sliding fee scales so that they can still access care. The problem with not having insurance is that when people need to go to specialty care doctors outside of our facility, that's a real challenge. So, you've heard it all before, so, but, that's kind of Pueblo Community Health Center in a nutshell. Our mission, our goal is to serve our underpopulated or served populations of people so that they can have healthcare and mental health care. So I have brochures. I don't know if, should I put them in a central location? People pick them up, or you want me to
Sure,
send
maybe
them
when we're
around?
done, we can set them right here in the middle, or,
That
yeah,
sounds
that'll be
really
good. People
We
can
could
grab
do
them if they
that.
want.
And then I have my cards as well.
Oh, that's great. Thanks, Julie.
Julie, do you want to talk about 340B a little bit? Talk about the benefits that that brings to the patients?
340B, I'm
No,
not,
that's the pharmacy benefit?
oh, the pharmacy benefit, yes, I'm sorry.
No, that's okay. I think that would be
I have
important.
something else. Yeah, we have a really good opportunity with Pueblo Community Health Center, and we have a pharmacy that's there, and we get funding for that, like you said, and it's reduced fees for medicines there. So something that would cost $300 at a pharmacy might cost them $2 at our pharmacy. We do get special funding for that. That was run by Cardinal Health for a long time with Pueblo Community Health Center. But now we have absorbed that ourselves and we have that internally, so they're not working and they're working for Pueblo Community Health Center, not for a pharmacy at this point. So we have all kinds of different benefits. We have podiatry, we have all kinds of different things that we offer to our patients, so. The important thing to note too is, for mental health care and for dental care, you don't have to have primary care. With us in order to access that, so anybody in the community can access those two benefits and just come to us. Our dental program is fabulous, we have a great dental program. And we have two different sites for that as well. One is at Lake Avenue by St. Mary Corwin Hospital, and one is in the East Side Clinic, so. But we have our pharmacies, dental, our lab, everything is in central locations.
I have a family member that we were able to get enrolled with 340B with Valleywine. They were ordering medication through Canada until that got stopped at the border, and they were getting their medications for about $400 for heart disease. In the US it was $1,100. But then they couldn't get it across the border, for various reasons. So the family member went to Valleywine, and it's $50.
Oh my God.
So it went from $1,100 to $50 in the States, just by the 340.
It's kind of amazing.
So
I was trying to help a
Big
lady
savings.
that had some problems with her eyes. This was a while back. And her prescription at Walgreens is $350 a month for eye drops. And when it costs 5 cents to produce, 5 cents. And so she came to us and she was able to get the prescription she needed for her eye care for a very reduced amount of money. But it's astronomical what is happening. So we just try to connect people with what we can. I run a whole program for case management. So like a mini social services, that's kind of my background is in social services anyway. And we connect people to all kinds of services outside of the clinic. So if they need to apply for SSI, if they need to apply for food stamps, Medicaid, whatever the service is, I run that program. And I have 10 women that work underneath me and to get people connected to housing, different things, whatever it is that they need. So there's a lot that we can offer with Pueblo Community Health Center.
That's awesome. Thanks so much for sharing all that, Julie. Sounds
You're
like you guys are doing a
welcome.
great thing. My question with the 25,000 clients, how big is your geographic region that you're serving? You said all the way to Kansas, from New Mexico to Kansas, but
And
that
that-
sounded like for just the
For
AIDS, HIV, yeah.
We encourage people to stay in their own areas for community health centers for services, but we will take them. So we serve from Trinidad because there's not a lot of services in Trinidad in some of the rural areas. So so we will take people that even live in Denver if they want to come to us. So we will take them. But the majority of people that we have are Pueblo residents, like 25,000. And we also have OB, so we deliver about 1 in 4 babies in Pueblo.
Wow.
So 1 out of 4 babies born in Pueblo are our responsibility, so.
You guys are busy. That's
We
a
are very busy.
cool program, the
Yes.
integrated piece. Well,
Yeah.
great. Well, thanks for sharing.
You're welcome.
Okay, before we kick it over to JC to tell us a little bit about the new flow of some state funding opportunity, I want to welcome MJ. Glad you could join us in person, and if you want to take just a second to introduce yourself, tell everybody who you are. We did that before you got here, just so that we know who the new person in the room is.
And a fun fact. And a fun fact, okay. Marjorie, I go by MJ. I work for Rocky Mountain SARE, National Farm Workers Job Program out of Rocky Ford. I serve that Arkansas Valley area along with JC Carrica. Fun fact, I have 5 kids. No one ever believes me.
Whoa,
Wait,
Yes.
what's the age range?
5, 2, she just turned 17 yesterday.
Oh my God.
16 year, I'm not ready. I'm moving on, but she's like, let me go.
I'm in the same boat. I've got a 7.
And then let me back in 2 years.
That's right, that's right.
This one's flying. Does yours want to fly as far away as possible?
Right now she is as far away as possible. She's on the west coast in Portland visiting some people, so yes.
Next generation does not get.
That's right. But to JC's point, my 19-year-old was moving back in August. So, that's right. All right, JC, passing it over to you.
Thanks. I'm gonna keep this really at the 30,000 foot view, so I'm gonna stay out of acronyms the best I can. Because behavioral health system in Colorado is very complex, much more complex than the physical health system. The first question is who these lyrics came from? Yep.
Bob Dylan.
Bob Dylan. A big Bob Dylan fan, and that's exactly where Colorado is, the times they are affiliated. And you'll see why as we move forward. I probably could just do it. You have 2 ports, Robert? USB ports?
Yep.
I got a clicker. It will help.
Because I.
Don't live home without it, like American Express.
No, it's just.
That's, you know, you're an IT nerd when you carry your own clicker.
You made to talk to me about that.
So the old way of doing business, and I'm glad Tony's here because being head of CCI, this initiative changed, came out of CCI about 3 years ago, but the old way of doing business in behavioral health in Colorado was the state was broken into 17 regions and also with 2 specialty care providers. And those were all community mental health centers, and those 17 plus 2, for about 30 years, were required to see everybody that came in the door, regardless of ability to pay, much like an FQHC philosophy. But 3 years ago, legislation was passed that came out of CCI saying that we want to do behavioral health different in Colorado. So the regions do no longer exist. And we'll talk about that as we move forward. Just for the sake of valley-wide, I serve for another hour. The green, the light green to the right and that black, so that would be valley-wide catchment area. Pueblo Community Health, you'll see is in between, kind of the darker green in Pueblo County. And then I'll be moving to the southwest, starting at 1, and I'll be in the 2 orange colored sections. So that's kind of the regions that I'm moving to, just to give you perspective. This will work, maybe it will.
Yeah, it's advancing. It's a little slow. Don't click too fast. Zoom,
Fair enough.
Zoom goes a little bit slower than.
Okay, so this is the legislation that came out, House Bill 22-1278 in as of July 1st, 2024, the bill created the Behavioral Health Administration. In the past, we referred to it as the Colorado Department of Human Services, and they had the Alcohol and Drug Abuse Division, et cetera, et cetera. Basically, it rolls up a lot of the behavioral health under one umbrella called the BHA. Part of the BHA deliverables per legislation was to create a statewide behavioral health grievance system, a performance monitoring system, develop this safety net system where when a person enters a comprehensive behavioral health provider designation, which is the new designation, that they should be able to they should be able to receive the same services at place A as they would do if they go across the state into place B. I say that a little bit with an asterisk because if you can't do the service at the clinic, it's gonna be your responsibility to contract with a service provider that can. So the idea is that it helps with the handoff and the continuity of care. So what we may be doing valley-wide, maybe PCHC does a little bit different. But if they come to us, then we would have to contract that essential service that we don't do so the patient has the ability to enroll in it. So it's creating what we call a comprehensive behavioral health safety net system to include crisis. Then they're moving to a regionally based behavioral health administrative service organization. So that is 4 regions in Colorado, and I'll show you that here in a minute, but they call those the BASOs, BHASO, or BAHASO. What's happening, I'm talking with my hands a lot, trying to make you, but what happens is any federal funding that has to do with behavioral health or substance use disorder will flow through the state and then to these management companies that will then contract those services dollars out to those provider organizations that qualify. The state also has their own legislative money, and they also have money that they match with federal dollars. So anything that's behavioral health, whether it's federal or state generated, is gonna roll through the BHA and into these BASOs, these administrative service organizations. Why that's important to this group is if you are looking at trying to expand or develop programming, these BASOs are a good place for you to go and say, hey, we have this idea, does it fit in your vision and your platform for rural Colorado, for frontier Colorado, for this population of people? And they do have some ability to carve out funds for projects, especially if they're meeting the vision or the mission of that region. So that's why it's important to understand the BASOs, because there is gonna be money. It's gonna be highly competitive. And one of the things I would add is really think about approaching them in a partnership lens, not as an individual organization. So bring your thought leaders together with different organizations with a really strong proposal and show how you're gonna coordinate care collectively to meet the needs of a special population. You can do it as an individual organization, but my impression and my gut is telling me we really look at more collaborative opportunities will probably have, will garner more attention. Does that make sense? And then the BHA becomes the licensing authority for all behavioral entities. So if you are gonna provide behavioral health services, you have to go through the BHA and get licensed. So they will be the oversight, basically the oversight committee.
JC, before you move on,
Please.
you may have said this, but the money that the BASOs are going to be operating on, are they funneled through the Senate bill? Like, has it been appropriated for specific things like these BASOs? They have their money that's given from the state?
So yes.
Did that question make sense? Yeah.
Yes, it does.
Okay.
So some of the money all of the money that flows to these BASOs is tracked back to either a SAMHSA initiative or state legislation. It's very much directed what the purpose of those dollars have to go to.
Okay.
For example, you talked about med-assisted therapy. There probably is gonna be components in these proposals from the state to the BASOs about MAT. Like we have a certain amount of money for med-assisted therapy, whether it be Vivitrol or naltrexone or Campo, whatever it may be. And if you look at our new administration and the Trump administration, there is a lot of movement toward opioid treatment as well as MAT services. So I think there's gonna be a lot of money flowing down for opioid use disorder and med-assisted therapy. So if you can think about crafting your project and incorporating those two things, there's probably gonna be what I would consider to be significant funds coming through this new administration. From the Kennedy side, very much a MAP person, very much an OUD person. So if you follow Robert F. Kennedy's history and his platform, you can kind of see where he probably is gonna want to allocate money. So the federal dollars that come through the state, that would be a good strategy. And what we know in rural and frontier communities is we're overrepresented in prescription drug abuse. So we can play that frontier rural card and say we're overrepresented in pain medication by the nature of agriculture, people with back pain, neck pain, shoulder pain, knee pain. It's really easy to just prescribe what, and so how do we leverage those dollars to maybe do creative things in our community?
Right on, thanks.
Does that answer that?
Yeah.
Question.
Sure.
You said that it would go from feds to state, which is the Bossos, or BHA, and then the Bossos is basically the managing company. Do we know who the managing companies will be?
We do. It's a good segue. And it's a couple slides, but I'll get there, okay?
Ready?
So 2 weeks ago, Colorado at the Capitol unveiled what they called their LIFTS campaign. This is under the Behavioral Health Administration. And what they're saying is this marks the beginning of the new behavioral health system at the request of the commissioners and the legislators in 2023. So the kickoff was literally 2 weeks ago. And it describes this LIFT system as a new way to connect people with a statewide network of mental health, substance use, and crisis support and care navigation. So rather than having buckets, mental health, substance abuse, crisis, and care navigation, like we've worked out of I've been doing this 3 decades, so 30 years, we've worked in buckets. The idea is we're taking all these small buckets and dumping it in a barrel and saying, how do we use all this money to create a more systemic, connected system of care so patients don't get lost? For example, you talked about the lawsuit about the young child that didn't get the care they needed, right? So the idea is, how do we create a system and use the funds in a more effective way is the intent, and kind of cross-pollinate things so that we have a better behavioral system in Colorado. So that's what the LIFTS campaign is. That was the kickoff of it. I'll try not to go too fast. So the BASO, real quickly, whether you call it BASO or BAHASO, we've heard of both ways. Their job is to establish and administer the network of providers and push the dollars out. So the state says, we need these services. The BASO says, okay, give us the money, we're gonna go contract with the providers. So the state no longer directly contracts with the providers like we did for a couple decades. We would negotiate directly with the state. Now the state says, BASO, this is what we're buying from you. It's your job to go find the network and build it and pay them to make it happen. So the management responsibilities are lessened at the BHA and pushed to a kind of an insurance company to monitor that.
JC,
Yes.
so am I wrong in what my own experience has been both privately and publicly as a former public elected official, is that rural Colorado, frontier Colorado has such a lack of professionals in their communities, and then attracting people that provide these services and having them establish practices is almost, well, it's pretty hit or miss, isn't it?
Yeah, recruitment retention is very different.
So I'm confused. How is this supposed to work if you're living out in Burlington and you just lost your wheat crop to a hailstorm and the bank just called and said, you're done?
So in the hallway, you and I can have a conversation, but in this room, what I will say is, the intent of the legislation was to get more money to the rural communities. That's what the whole movement from CCI was intended to do, is to make sure that the frontier rural communities are getting their share of the funds to build capacity and address retention. Do I believe that's gonna happen? Not sure. I mean, it was July 9th that they're like, we're ready to go. That was the intent. The legislation really blossomed out of southeast and northeastern Colorado, rural commissioners, with the intent to address those things.
Okay.
Now it's gonna be 2 to 3 years before we know whether we'll reap the benefit.
Okay, thanks, JC.
Yeah. Other questions? So I think your question was, so who are they, right? So there's 2 organizations that bid the 4 regions in the state. Signal, which because I've worked with for 25 years, they have region 2, 3, and 4, and there'll be a map in a second. And then Rocky Mountain Health Plans, which has changed its names a few times, but they've been around a long time as well. It's a new organization for me to work with. I don't know a lot about them other than they've been around a while. And they are taking region work. So there's the nice thing about the good thing about the providers is you only are gonna have to contract with 2 organizations across the state for the behavioral health money. There was a potential that you were gonna potentially have to negotiate with 4 different companies, depending on where you serve. So that's a good. Just put me on the clock if I need.
Okay, I will. Can you tell us Signal and Rocky Mountain Health Plans, are they a conglomerate of like insurance groups or what? What type of an organization are both of them?
So again, 30,000 foot view,
Yeah.
keep it simple. Rocky Mountain is part of United Health.
Okay.
United Health,
Yeah.
so insurance company.
Yep.
Signal is a provider owned, for the most part, provider owned organization out of Denver. That has managed substance use dollars for over 20 years. So they are a Colorado based, strictly Colorado based company where Rocky Mountain Health Plans has some national reach. Does that help?
Yep, totally, thanks.
Try to go quick. I know it's confusing. That's what I'm trying to say. High level. So they're the regions, just so you can kind of see how that played out. So your yellow, orange, and green are Signal. And your blue is Rocky, which I believe Rocky is headquartered in Grand Junction.
Right. It was like, it used to be Rocky Mountain Nature, that whole thing out
Yes.
of Mesa County, right?
That's correct.
Okay.
Yep. So it just ad-libbing a little bit, but you can see where literally my world is totally shifting. I'm having to learn a whole new system of care, whole new companies that I'm gonna be working with that I've never done before by moving to the Western Slope. Then just quickly, just move us forward. If you're looking at Medicaid in Colorado, that's managed under healthcare policy and finance. That money is also being pushed to what we call regional accountable entities. They look like a BASO. The money goes to them, and then they contract with providers in the Medicaid space. And the regions are the same. Okay, so the map doesn't change, which is nice. So as a provider organization, we know your region. So you have the Medicaid and the non-Medicaid dollars. There are 4 rays instead of 2 BASOs. And each ray represents a different color on the map. So you have Colorado Access, which is Adams, Arapahoe, Denver, and Douglas. CCHA, you can see the counties. Northeast Health Partners, which is all of the Eastern Plains. And then Rocky Mountain Health Plans, which was that big blue area on the map prior. So for your rural counties, for the most part, it's an L and a reverse L. In the behavioral health world, we call it the donut hole. So the donut hole is kind of your metropolitan counties, and then you have your Northeast and your Eastern Plains as the donut hole. So the outside is gonna be represented by Northeast Health Partners and Rocky Mountain Health Plans. Those will manage the Medicaid dollars in your most rural counties.
So Rocky Mountain Health Plans is the BASO and the Ray.
They have
for that
both.
area, Yeah.
That's correct. And wear both hats.
Yep.
And it gets even more confusing where Northeast Health Partners won the Ray, but they're outsourcing their management of the contract to Rocky.
Oh, great.
Yeah, so they even can parcel out responsibilities
Yeah,
as a contract provider.
gotcha.
Yeah. And then my last slide. You feel like your head's exploding. This is me all the time, trying to figure this stuff out, right? Your hair's on fire, running around, trying to make sense of this. Questions?
Does anybody in the United States do this right? No, I mean, it's a serious question.
Yes.
To your knowledge.
Yes, there, very simple response. There is a model of care called Comprehensive Community Behavioral Health Systems. Or centers, CCBHCs.
Okay.
They've been around about 15 years. It is supported by the Trump administration as well. And states are taking that model and embedding it in their states. Which high level. If you become a CCBHC provider, you guarantee a list or a menu of services that anybody walks in the door will get. Ironically, it's the exact same list the state is trying to build through this. Crisis, continuity of care, SUD, mental health. The system's there and it's been there. Colorado is dipping their feet in it right now through Medicaid to see if it would be, if Colorado would be a good pilot state to roll it out. If Colorado adopts CCBHC, you get more federal match. I mean, it could be, we're talking tens, if not hundreds of millions of more Medicaid dollars that would come into Colorado if you take that designation and you agree to have more of a federal system than a state system of care. Does that make sense? As long as Colorado does their own system, they're losing a lot of federal match Medicaid money.
Right, but federal, the Senate House just passed a bill that reduced, according to, well, whatever I'm reading, which I think is
It
legitimate.
reduced some of the
journalism.
Medicaid match. But we don't, but if we were a CCBHC, that's a caveat in the legislation that says Trump says he still supports CCBHC.
So give me a state,
It's a word.
give me a state, what's a state that's doing this?
Oh my gosh, Missouri, Oklahoma, there's 25 states, I think, right?
That actually have something better than what we have.
We're 50th in funding,
Well,
so there's 49 states.
So we actually lost down to Mississippi for something?
We are number one in the law.
Interesting, okay.
So there's a lot of opportunity to do better things. The state's trying their own thing, if they work. There's also a federal opportunity to try to replicate that, which the state is investigating to see whether it's appropriate for Colorado.
Thanks.
So where did you?
My hair is on fire.
Okay, I'm gonna move us forward. If you
Yeah.
have more questions for JC, grab him before noon when he heads out the door and we'll get his new email.
Alright.
Yeah, okay, thanks for that overview, JC. That's really helpful. I too had questions that I'll reach out to you about because that does sound confusing and, yeah. Okay, excellent. Well, Maddy's here online. Maddy, welcome.
Hi, how are you?
Hi, I'm gonna pass it over to you to introduce what you're gonna be talking about, but glad that you could join us. This is the Agriculture Behavioral Health Working Group. And we are mostly in person here at CSU Pueblo, and Julie Elliott, who is on the screen with you, is also a member of the team, and she's joining us from Grand Junction. So take it away, Maddy.
I'm very nervous. I don't do presentations like this very often. Thank you very much for inviting me. And I'm going to try to share a PowerPoint if I can. Actually, Robert, are you there?
I am.
So can you share it? Because I know I'm gonna screw it up, so.
Well, you're gonna let me screw it up. That's a smart strategy.
Yeah, no, you're saying, I've shared hundreds of PowerPoints and I never get it right, so I think you're wise to let Robert do it.
Okay. So I'm gonna go a little bit off of script because I am a writer, not a speaker. So Robert, if you can bring up the first slide.
Okay, I'm working on it.
Oh, wow.
Let me know because my settings are such that I can't see anything right now.
Yeah, that's the way I aim to this.
Maddy, while Robert's getting that pulled up, tell us where you're joining us from.
I am in a neighbor's house in Dolores, Colorado. I'm living in an RV with no internet at the moment, so I'm mooching off her Wi-Fi.
But you're down in Dolores.
Yes, sir. Yeah, and I'll get to that. It's part of my presentation, actually.
All right, I think Robert has your presentation pulled up. We're not quite in presenter view yet.
Okay,
But now we are, well,
Robert, you
okay.
there?
Hey, yeah, that looks awesome.
great.
Okay, that's slide one. And Robert, if I could prompt you to advance it as I go along, that'd be great.
Hold on one second, Maddie. We're gonna try to figure this out. Also, hi.
Hi.
That's Catherine.
Yes, Catherine is the reason I'm here.
Excellent.
Call her Catherine DeBerto.
Catherine's great.
Right.
But then her reason to it, but it's.
Oh, wait. I know how to do this.
There's a button at the bottom of PowerPoint.
Maddie is the woman that you finished from Buck the Trend.
I know that.
Buck the Trend, it's a organization from the, I guess, Southwest.
Oh, okay, got it, all right.
There we go.
Robert can now advance the slides for you.
Thank you.
Okay. So I just wanted to say thanks for inviting me. I've taken a look, thanks to Robert, at the agenda and kind of how your outlay is, and you are very qualified and very ambitious. So hats off to you. This is a very difficult and complicated undertaking, and I hope I can help in some way. So I developed Buck the Trend as a 2-day forum, kind of like a workshop for people in my community. My community, I guess I define as pretty much anyone involved somehow with horses. Slide 2, please, Robert. As I said, I'm Maddy Butcher. I live in Dolores. I wear a lot of hats. For the past several years, I've been day working for ranchers here in Montezuma County and also over in Creed. Slide 3, please. I was in Creed, in fact, when Luke Bell died. He was a 5th-generation Wyoming cowboy and an up-and-coming country music artist that you folks might have heard of. He died of an overdose on the streets of Tucson in 2022. Peter Campbell on the left here died in 2017 of a self-inflicted gunshot wound. And I was asked to write a piece on Peter for a horse magazine after he passed, a kind of a obit memoriam. And the editor did not want me to mention that he killed himself. And that really bothered me. Slide 4, please, Robert. I am not a 5th-generation rancher. I grew up on the coast of Maine, and many of my classmates and friends were and still are lobstermen and fishermen. The lifestyle is very similar. It's one of staunch independence and self-reliance, as well as isolation and stoicism. Mainers are famous for either no response or a one-word response, like, hey, yeah. The picture on the left is the harbor in Harpswell, where I'm from. You will notice that nearly all the boat, or maybe you don't notice because you don't know boats, but they're all commercial vessels for lobstering and fishing. Nearly none of them are recreational. Anyway, when I first started researching ways to help my community here, I talked with a group that's doing something similar back in Maine because we have so much in common culturally, work ethic-wise, work-wise. Slide 5, please, Robert. So as the slide says, there's culture, and I guess I'm kind of preaching to the choir here, not telling you guys anything you don't know, but cultural, logistical, economic, social impediments to getting help and being well. And that our wellness impacts not just each individual, but family, friends, and the animals. So the group that I reached out to, it's called slide 6. They developed a wellness program and they paid a lot of attention to their community. They did a lot of listening. And that's one of the challenges that I'm finding in our mental health environment here is that there's not a lot of listening going on. There is very much a trickle down approach as opposed to trickle up. So they realized in Maine that most health professionals don't have any clue about the specific stressors and challenges of lobstermen and fishermen. So they built a webinar called Fisherman's 101 to help therapists, doctors, health professionals of any kind with everything from the vernacular of lobstermen, how, vocabulary, to a repetitive injury, to culture. So that's one thing that I've often thought would be super helpful to us in the rural West, is to have a conversation or some kind of program that just gives some schooling to people in the mental health field. I've talked to exactly one person over my dozen years that knows anything about why, for instance, I broke my wrist in 2 places last year, and he was the one person that understood that I couldn't have surgery until the fall gather, which meant working with a broken wrist from July to November. That's just a small example. Slide 7, please. Let me see what it's a picture of. Oh, so that's just some examples of me. The picture on the left is just the hellacious fencing that we do every year. The picture on the right is just the immense country over in Creed. The permits some people are working on are the size of Washington, D.C. in terms of mileage. And I know from the bios that a lot of you know how remote things are. So anyway, channels were opened up. And again, this is kind of using Maine, the progress they made in Maine as a reference. For getting therapy, found that most didn't have access because of not wanting to deal with bureaucracy, which I listened to just before my presentation, and insurance issues. Most of the time also, it was the wives who are making initial inquiries. So they listened and adapted, and they put people in place who understood and could relate to, in our situation, rural, remote, ranching oriented Colorado. What they didn't do, and what I found happens routinely here and routinely in the rural West, is, as a woman in Idaho told me, we don't want a new college graduate with purple hair and a pierced nose telling us what's good for us. And that is something that is repeatedly a problem. We don't want, for instance, nonprofit swooping in with money, but also with an anti-gun agenda, because we need our guns. So, I've obviously been thinking a lot about this. Where are we on slides? Let me see. Can you go to the next slide, Robert? See what it looks like? Okay, yeah, that's good. In the Peace Corps, for instance, volunteers spend 3 months not even going into the community to train on how to work in a community. And I feel like, wouldn't it be great if people, I had the opportunity, for instance, to meet behavioral health administration people a few weeks ago. And if those people in positions of power and positions of funding could just spend 3 days in Dolores, up on National Forest, in Creed, to get a better appreciation of the challenges and stresses and what it's like. I think it would just, if it has to be a afternoon field trip, I'd still settle for that. It's just, there's such a gap in knowledge and understanding and empathy, really. And let's see, are we on slide 9, Robert? Do you know?
I have no idea. I'll go with that.
Okay, solutions. Thank you very much. And just as an aside, one of my challenge, and I shared this with Catherine, was funding. And I could prepare a whole presentation on that. That's a topic for another day. So I built Buck the Trend based on what I felt was a successful program with the equine conference that I ran for 5 years, which is 2 days, multiple sessions, lots of breaks, good food, time to socialize, with very clear stated goals in advance and a wrap up and kind of a debriefing at the end, as well as survey taking. The biggest difference between that equine conference and Buck the Trend was size. So we had about 200 at the summit, the conference that I directed, and 20 people or less for Buck the Trend. Next slide, please, I think. Great, thank you. It went well. It didn't cost very much. There was a lot of attention paid to detail and a lot of advanced work, which goes back to doing the research and knowing the community and having lots of one-on-one conversations. And let's see, next slide, please. That's our initial group. That was last year. And next slide. That is what I believe we accomplished through surveys and lots of post-event conversations. And last slide, I think it's the last slide. Yeah, that's me. So thanks. I'd be happy to answer any questions. I know this is probably really off topic for a lot of you that are really in the policy and more tech and bureaucratic type or administrative type of things, but I was real happy to share what we're doing down here.
That's why this is on topic for us, Maddy.
That's right, Maddy.
Gotta know.
Yeah, thanks a lot, Maddy. You got very little representation of anybody that's real techie here. The rest of the stuff, we tried to navigate those conversations, but this was right on point. So really grateful that you were able to join and share. Are you still on with us?
Yes.
Yes, yes.
Okay, good. Does anybody have any questions about Buck the Trend? I had a question, Maddy. Do you have any, I saw you threw your email up, but do you have a website or any, like, I don't know, PDF that you could send to Catherine and Catherine could share with the group about your program?
I have a ton of information. So I do a different podcast now. It's a radio segment that's being played around Colorado and the Rocky Mountain West. But before that, I ran a podcast called Best Horse Practices. And there are numerous episodes dedicated to interviewing people before and after Buck the Trend. We interviewed the therapists, we interviewed attendees. That's a really good resource. And then Best Horse Practices, which is one of my 6 websites that I run. So it's besthorsepractices.com. If you go into the search engine and just search Buck the Trend, there's probably about a dozen pages dedicated to it. And yeah, just take a picture of my number and my email. I'd be happy to send those links.
Okay, that's awesome.
You can also send them out. Yeah.
Okay, yeah. We have them and we'll send them to everybody. Does anybody else have questions about what Maddy shared?
Just, Maddy, do you know Haley Leonard? Does that ring a bell?
I do not. Should I?
This is JC Carrica. I'll reach out to you and I'll make a connection out of Cortez.
Oh, great. Okay.
Thank you.
Yeah, Maddy, thank you. This is Robert Sakata. Thanks so much for taking the time. This is perfect timing because as you probably saw on our website, part of the charge of the legislation is to have an annual summit. To do that, to focus in on trying to reach out to people that have opportunities to set up behavioral health in their communities. So I think this is a great example of what you've accomplished. So we may be reaching out for you for more information and some advice.
Absolutely. Maddy, before we let you go, or you're welcome to stay and join us for the rest of the meeting, but have you done much work with folks in agriculture that are doing like ag production work, either with crops or rancher specific? It seemed like a lot of the work you were doing was with people with horses and in the ranching west, but are they production ag or are they more horse equine folks?
Let's see. I'd say at least half of the attendees were ranchers or working cowboys.
Great. And how many have you done?
Just that pilot one. We have ones planned for Oregon as well as Idaho.
Oh, awesome.
Yep.
May I jump in?
Yeah, Tony.
Maddy, the Tony House from Los Animas County. I don't know if you've seen the legacy, but I'm the cowboy on the gray horse, and I got to tell you that this is impactful what you're doing.
Thank you.
Having run 1,000 head of cows with 14 head of horses on 50,000 acres, I can identify with what you're trying to get out there. So thanks for what you're doing.
Thanks for being out there and thanks for being part of this. One of the, I was happy to see in the bios that a lot of the folks involved do have experience in the field, so to speak. And, you know, like I said, I'm not a Colorado native, but I often say, you know, if you just swap out the islands and the peninsulas, if you know, the public land is public water in Maine, and it's equally remote and equally dangerous, and hazards are very comparable. And so while I don't bring a legacy to it, I feel like you know, there's a common bond that we all have, that we can understand each other. And I broke my wrist coming off a horse, not falling out of a boat.
Well, so much data is reported through farming, fishing, and forestry collectively. I mean, it just naturally, that is the same mindset. So we appreciate what you're sharing.
Absolutely. Thanks for joining us, Maddy. And like I said, you're welcome to stick around and listen. We've got a couple more people that are sharing before our lunch break, so we're going to keep moving, but I appreciate you being here.
Thanks, Maddy.
Thank you.
Thank you.
Thanks, Maddy.
Thank you very much.
Thank you.
All right, and with that, Carlyle, I'm going to pass it over to you. Glad you could join. And Carlyle is going to talk to us a little bit about the preparation for the state summit and his work with RMFU and Agwell.
Very good. Thanks, Clinton. Yeah, thanks for having me, everyone. For those of you I haven't met, my name is Carlyle Stewart. I work with the Rocky Mountain Farmers Union. I'm based in New Mexico doing membership coordination for the state of New Mexico, and then also running the Agwell program as well. And I'm based in Tierra Amarilla, New Mexico, which is maybe about 20 miles or 20 minutes south of Chama, not too far from the border. So I'm pretty close to Colorado and the San Luis Valley. And yeah, as many of you have probably heard, Rocky applied for and was awarded the grant for an amount of $7,400 to host and sponsor a behavioral health summit sometime this year before the month of December. And it's been great working with Robert and a couple other folks on staff, you know, figuring out how we want to structure it, where we want to have it, and also what is the aim of this summit and who do we want it to actually be for, right? So I was just going to share a little bit more with you about where we are in the process right now, but then also just in general what we were thinking for the summit. and also opening it up to you all to hear your ideas, suggestion, or any other things that you may have to offer. So so right now, as it stands, that the goal of the first part of the summit, we're thinking about either breaking it up into 2 days or just 2 parts. And the goal of the first part is to create a space where rural behavioral health professionals and those in ag adjacent roles can convene. They can share more about the progression, development of their work, and how they can better meet the needs of producers. And another goal is to create a space where people can network, and folks can learn about what are the available behavioral health resources in the state of Colorado, that can be for farmers and ranchers, and how can they refer people in their communities to those resources and better just, I guess, refine the process of getting people connected with those things when they need them. So that's the first part of the summit, which will likely either be the first half of the first day or the first entire day. And going on to the second part, one of the ideas that myself and a couple other folks on the work group, and as well as folks in Rocky, had was having a 2-part summit where the first part is meeting the needs of folks working with people in ag adjacent behavioral health professionals, and where the second part and or second day of the summit is going to be more tailored towards farmers and ranchers. And this, I think, directly applies to something Maddy was talking about recently with the work that she's been doing. So often we understand that there's a lot of stigma within rural agricultural communities, farmers, ranchers, farm workers, about these topics, and creating spaces where people can more candidly talk about the challenges and the things that they're going through, but also learn more about, stress management practices, all possibly even having trainings that we offer at the second part of the summit as well. Um, and, an idea came to me not too long ago where I'd really like to design this second portion of the summit to focus on creative and artistic ways where people can share their stories, share their experiences, share their challenges through the medium of art, poetry, and or music. Um, so there's a few different organizations that I've been talking to. There's some folks who work with the National Cowboy Poetry Gathering, which happens every year in Elko, Nevada, which is obviously, getting people together, talking about, Western culture, cowboy culture, ranching life, challenges, successes, the beauty of the life of agricultural work through the medium of poetry. So one thing that I would really like to do is create a space where farmers and ranchers who are attending can share their experiences through those forms, and really have it be about music, food, fellowship, and having an open mic situation where folks can, like I said, share their stories. So that's the general overview of how we're approaching it now. And like I said, we're still trying to figure out if it's going to be 2 days or just divided up into 2 parts. But I'm really eager to hear any suggestions or thoughts that you all may have about the summit. And I know after talking to a couple people last year, or about the summit that you all had last year, also in Monte Vista around the same time, that it was pretty successful. There was a pretty good turnout, and I'm sure there's a few of you that were involved in that. So yeah, that's where we're at now. Right now, I'm really in the process of developing the programming and figuring out who are the speakers that we want to have. What are going to be the different activities and the asks that we have of people. And yeah, I'm open to suggestions and conversation about that. And then also, we're going to be talking about these things in the working group as well. And I'd love to, I don't know if she's still on the call, but it looks like Maddy might have jumped off. But yeah, I'd love to see possibly how, we can collaborate with some of the work that she's doing as well to maybe weave in some of what they're doing in the summit as well. So yeah, that's pretty much what I got. And the tentative date right now is November 13th and 14th in Monte Vista, Colorado. Potentially at the Sky High complex is what we have for the logistical scheduling and location. So
Excellent. Thanks, Carlyle. Yeah, I'm gonna open it up if that works for you for any questions or ideas from this group. That sound like a good next step?
yeah, that sounds great. Yeah.
All right. Anybody who's on the call or in the room have thoughts for Carlyle? I think I heard a call for what to include and potential speakers, and if that format focusing on ag organizations the first day, and then it sounds like maybe Rocky Mountain Farmers Union sponsored second day that would focus on farmers and ranchers. And
Sure.
the idea is in Monte Vista at the Sky High conference center. So turning it over to this group.
I'd like your info to connect. I think, that, I mean, sounds great. I'm excited to do my part if you would allow and just kind of help you organize those connections with, people with horses or, any farmers and ranchers for the activities part. And then, social media, the campaign, pushing it out there, the outreach portion, as well as translation. That can help in those aspects. Yeah, I mean, it sounds amazing. Music, food, fellowship, open mic, like, yeah, let's do this.
As long as there's no karaoke.
Yeah, that's my worst night. I don't like karaoke.
Everybody put your phones away.
Yeah, no video, no, what happened there, stay there.
There is no evidence.
Love it.
Real quick, if y'all don't mind, do you mind just saying your name and who you are before y'all share, just so I can make notes of where you're coming from and like the additions that we're gonna add here?
MJ Guzman out of Rocky Mountain Fair and Rocky Ford.
Okay, excellent. Thank you. Yeah, thank you for your suggestion.
But
Yeah, Matt.
so Carlyle, Matt Heinrich, I'm actually I guess I'm the chapter president of the Rocky Mountain Farmers Union Lower Arkansas Valley chapter. But I do think,
Yes.
I signed up for vice president, which is usually the safest position
Oh, no.
until you get posed. But I think Monte Vista is actually a great place to have it. I don't know if there's any, I mean, there's probably a valley or a place in the state of Colorado that's, I don't know, the San Luis Valley is just all ag, right? So a couple of things, I think. First of all, I know that, as someone that's been almost doing this for 40 years, we get into routines, right? We drag out the same baggage all the time. I would make the second part or whatever, where the farm and ranching community is there. Let's make sure that we have good representation from our younger farmers and ranchers, right? I mean, healthy young farmers and ranchers will be, I think, healthy older. Healthy farmers and ranchers is my perspective. So let's figure out how to, because they're out there, right? There's a lot of great young producers in the San Luis Valley and quite frankly, in the state. We just have to figure out how to keep them healthy. One thing that and JC and Julie, I'm gonna ask you guys to help me here. So, I find myself going to doctor's offices more often than not nowadays. And when I'm at my family doc, I'm always given the test, right? Right? Do you want to blow your brains out on a scale of 1 to 10? Well, I mean, the price of corn dropped 40 cents. Yeah, I think I'd like to do something. But I'm curious, I'm very interested in when we're talking behavioral health, and I'm gonna talk from personal experience, some of us have something in our being and our chemistry that needs help. How do we differentiate and get people the kind of help they need from a pharmacological perspective as well as just normal therapy and ways of coping? Could somebody help me with that? Like, I don't know, is there a place in the day where you take the little 10-question test and add up your score and say, oh my God, I'm really depressed. Can somebody help me?
So there's a depression screening that does happen. Based on the score, it's elevated at different levels. Like call right now, follow up in a week. I mean, that's a typical process.
Right. So then
If you're
how do
going through your normal.
you're going,
Because everybody does their annual physical, right? Right, so that's a problem.
Well, I
It's like
did-
catching people.
well, now that I'm 67, I gotta do the Medicare. I get to do the Medicare thing. Yeah. So I did it.
Your annual wellness visit.
And I did my wellness visit.
Most of the referrals I see that come for behavioral health are peer to peer. So it's Tony, for example, calling somebody and saying, hey, Ron, I'm worried about you. I know a guy that I'd like you to talk to. And then Ron would call JC and then I would meet with them and encourage them to access services. It's not through a church. This population is not through a traditional depression screening with your primary care provider.
Okay,
It's very much, I know somebody I trust, I'd like you to talk to, at least give them a call. I get those every other week.
so would
And
you
I say half of the people then engage in behavioral health after I speak with them.
So-
Some of them, it's connecting them back to church. Like, it's not always therapists, it's connecting them with groups that are supportive and
Right.
like-minded.
Right.
That's my opinion.
So for Carlyle, we really need a way for us as farmers and ranchers to understand and be able to listen and then take that next leap of faith and tell somebody we're worried about them.
I think it starts with a conversation, how do we build community trust in our community? Then you can get people in services.
Well, I'd also like to add that these are populations, and it really doesn't matter, but these populations in general, they are the ones that are like taboo about mental health. So in the recent years, this is new to accept that I need help, new to accept that it's okay to cry, new to accept, right? Because these are the populations and generations that are raised to be boys don't cry, right? Like you tough it out and don't pull your boots and all that stuff. Great. However, you don't have to, I guess, punish yourself, like you can be resilient, but again, this is like JC said, we have to sit down and talk about, what you do to cope with things, but the deeper root of it, like what is it that we all kind of are in the same boat about, right? Is it family violence? Is it alcoholism in our homes? Is it sexual abuse? There are so many things that, connect us more than sets us apart. And I think exploring those topics in a very careful way, empathetic way, but also you have to bring it forward. Like, this is not the time to hide. The suicide rates are at an all-time high. The kids are, we are wiping a whole generation out with fentanyl. What was that last one?
Yeah, I
Oh, yes,
think-
yes.
And the demographics, unfortunately, it doesn't matter what color you are. If you're poor, you are the wrong color.
Yeah.
Jacob.
Carlyle, this is Jacob Walter, somewhere between Fowler and Pueblo at any given point usually. Just for the group too, one of the things we talked about in our engagement subcommittee as it pertains to the conference, because I know you're asking for feedback. This is more of a question for me. I know one of the focuses that we had for this summit was how do we make the most impact, which seems to be how do we engage providers and folks in communities. I love the component of reaching out to individuals too. I think my 2 cents, as for my role on this task force too, is really focusing on those providers and the folks that are gonna then go out and make a larger impact. That's part one. The second one, just as y'all are working on putting this together, and I don't know the right answer, and I don't know kind of the reasoning with Monte Vista. My concern being November and Lomita Pass and trying to get folks down from Northeast, Northwest. It's not a very central part of the state, so I don't know the reasoning. I know the central part of the state is not the group that we're necessarily trying to target. But it was just keeping that in mind from getting those providers to wherever this is gonna be in November. So.
Thank you, Jacob. I was thinking the exact same thing. This is Julie Elliott, behavioral health specialist with CSU Ability. And yes, come November, we don't know what the weather is like in our mountain areas, parts of the state. And so we're really going to need to, if we're having it in November and we're going to have it in Buena Vista, then we need to have some pretty dynamic speakers and things like that, I think, to pull in the providers. Also, it may depend on what days, like, are you doing it during the week or on the weekend? Because providers in my area anyway are starting to book up 3 to 4 months already. And so for them to have to cancel clients and things like that, that's going to be hard. for them as well. So just keeping that in mind, let alone the farmers and ranchers especially ranchers who have cattle to feed and things like that. So having a 2-day, I could see how it'd be cool if we could have them all kind of get together and intervene with each other, but I don't know that that's going to work. So maybe having the 2-day program where you have the one, like you said, with the providers, and then the next day, the farmers and ranchers, that might be best so that people aren't having to take too much time away from their home and livestock.
Thanks, Julie. I'm realizing that we're going over time a little bit. Robert, the meeting that we're gonna have to talk about the Behavioral Health Summit, is that something that could be opened up to more people on the group so that this conversation could continue there? Or since it's not talking about the Ag Behavioral Health Work Group, would that be something that we could do without it having to be navigated with the bigger public platform? Or is that something that, I don't know the answer to it, that's why I'm throwing it your way.
Yeah. Good question.
Cause it's for the summit specifically,
Yeah.
not pertaining to this group, but I'm just realizing this could be a really rich conversation. And we don't have that much time scheduled for it today, so trying to figure out how to move forward with it. And wanting to support Carlyle so that he gets feedback that he wants from this group and from farmers and ranchers.
Yeah. So we have those monthly planning update meetings, so we can share them with the whole work group, and anybody that wants to join can join.
Okay, that's awesome. Because before we finish, I appreciated Tony drawing my attention to Jacob, and with you folks that live down in the southeast, I know that you guys are really spread out, and getting folks to participate might be a task from over there, because it will be a tour. Anything that you guys can think of, if it wasn't, I mean, it sounds like Monte Vista is a centralized location and something that's good, but anything that you guys can think of that we could do or include in the summit that would draw people?
I think location wise, it's always gonna be who's it hard on.
Yeah.
Situation. Also, a huge thank you, Carlyle and RMFU, for taking this on. I think it goes back to like what Maddy said. I'm not a provider. I'm not the target demographic for the summit.
Yeah.
So I'm gonna defer for other folks and what's gonna get them there.
Yeah.
I'm gonna mention something that Robert has spoken about numerous times. So a lot of times I'm in meetings and I'm the only person that doesn't have a real job. I just keep dumping money into a farming operation. Literally, by the wheelbarrow loads. Give somebody some incentives. Give them a mileage stipend or help them with a hotel or something. Every time you'd be surprised. I mean, you drive back, I mean, I can afford it, right? I mean, I think I can. I got a good banker. But for a young person or someone starting out, they're looking at $150 worth of lodging and another 150 or 200 worth of gasoline back and forth. I mean, try to set something up where there's a scholarship or a stipend program or something. And I bet we could beat the bushes and find a way to do it. I really do.
No, that's good feedback, Matt. I think that we have that set up for the farmer rancher component, and for the producer component, most of the folks will be leaning on their organizations to hopefully get them there, but if they can't, there's money that can be. The providers would be leaning on their organizations to get there, and if they can't, then we have funds that they can apply for, so that'll be good, yeah.
Okay.
But anything else before we move on, and then I'm gonna pass it to Tony, but what you guys think we could do to get folks from these frontier communities to make the drive? I mean, even just the providers that are in these remote places, because it'd be awesome to get them to produce.
When is the Southern Rocky Mountain Ag Conference?
Did you say when is it? It's usually in February, I think. Yeah.
I mean, one of the things for providers, we make sure that if we are going to do presentation, we can offer, at least, they don't necessarily need CEs in Colorado.
Oh, yeah.
You can have certificates that go towards documentation, management, license renewal.
I know a group.
Yeah.
All right, well, then, Robert,
The other question I'd like to pose to everybody, because again, I'm not in the behavioral health field, is we toyed with the idea of really providing tabling opportunities. As I'm learning so much about what's going on, it seems like a lot of programs are out there and just getting the information out there. So would people that have, like the postcard one that we just viewed, do you think those type of people would be willing to share and come to a conference and have an opportunity to have a booth?
Yes,
I think that would be awesome to be able to provide
we
free.
killed it at the Ag Conference.
Yeah,
Southern Rocky Mountain Ag Conference, we received so many leads from our providers booth. So many leads, it was great. So I would, yes.
yeah, and that Southern Rocky Mountain Ag Conference, I mean, there's a networking opportunity there because there's so many people, you're running into people, and I think that's a great idea, Robert, to really promote the boothing.
I have to tell you that outreach events are really great for us. We can go to just about every outreach event that we're invited to, and have things there for everybody. And we get so many leads off of people that need, this is crazy, off of behavioral health. I need behavioral health, my children need behavioral health, and also dental. So we find that to be a really big thing, but we try to get to just about every outreach event and just try to reach people by onesies and twosies to get them in for care. I mean, it's been pretty nice, so.
That's awesome, that's a great recommendation.
And in the larger organizations, those are allowable costs in your expense.
Yeah.
Feds. So it's like what she says, we're encouraged. We're theoretically reimbursed through our rates to do outreach,
Yeah.
so the big
That's what I was
organizations
wondering.
are getting help.
Okay.
Yeah.
Perfect, that's what I was wondering.
Yeah, small organizations maybe, but bigger ones.
All right, Carlyle, I hope this was helpful, but I do hope that with the planning meetings, we can invite more people and you can continue to get more information, but, can you give everybody your email address so that if people have thoughts or they want to, reach out to you, that they can do that? Is there any way that Carlyle can drop that in the chat and you guys can share it? Or?
We could put it in the notes. I
Oh, okay.
already put it in the chat.
Oh,
It's in
perfect.
the chat.
Robert.
Yeah, it's already in there.
In the chat, it's phone number and emails.
I find right there. Love it. Okay, then Rosie will send it out.
Exactly. And then just two, also online, Catherine Diaz just mentioned, her comment online was, Weld County and Yuma County are the two largest agricultural counties in Colorado. Can we get a summit in Northeast Colorado? Maybe something to think about for future years. So just so everybody knows, the legislation calls for an annual event. And I think that is one of the goals, is to definitely move it around the state. So JC, thanks for the cantaloupe.
Yep.
Oh my gosh.
Got to start schooling like cantaloupe.
I know, I'm looking forward to it. And thanks again for all your support.
Yeah, see you guys next
Okay,
week.
we'll see you soon. Okay, and just wanted to make sure that, we can push it back to lunch just a little bit so that Tony can share. You're staying for lunch, right? We're not in your, afternoon plans? Okay.
Yes, I am.
Yeah, okay, excellent. Well, then I'm going to pass it over to Tony Haas to talk to us a little bit about his work here in Los Animas County and his connection, like you mentioned earlier, to ag behavioral health and what he's done.
So years ago, back in about 2018, we had some numbers come out on opioid usage and overdoses and everything that was happening in the Huerfano, Los Animas County area. And we topped the state in overdose deaths and usage, and I could see a real need as the safety and health director of the Colorado Farm Bureau. I could see a real need that we needed to address this in some way, give back to our members. And it just so happened that Sally Clark was the director at USDA, and there was a grant process that was floating around. It was in the process. They hadn't developed it yet, but she introduced it at one of our Farm Bureau meetings that maybe the USDA could do this grant process and help with MAT. So the medical assisted treatment van initiation. So it wasn't even, it was just a concept at the time, and Sally had said, would there be a need for something like that? I jumped all over that. And we got our first MAP van at Los Animas and Huerfano County. And so it's been a real, it's been teamwork to make all of this happen. And Chad's been a huge help down there in Los Animas County with our health department. And back in 2022, I believe, we were running out of those funds. Of course, Sally was no longer there. We were running out of those funds. And we needed some more help to figure out how we were going to transition. We got another MAP van and those funds ran out. But in 2022, I'm on the health board at Los Animas County, and I told them we need to reach out to the CAMP program at the Colorado Farm Bureau. They were right in the beginnings of their approach, and Chad was able to help us with some more funding. We're a bi-county health district with Huerfano and Los Animas County, and we wanted to be able to help those counties with free mental health resources. And our partners ended up being the Farm Bureau CAMP program, the I Matter program through the state of Colorado, and the Colorado Trust Foundation with grant funding. And our Los Animas County program is funded through the Colorado Trust Foundation. And what initially happened was there were six visits that were allotted to an individual, free days to come into the health department that was funded by the CAMP program, through the CAMP program. There was initial 4 days, that 4 more visits that were funded through the Los Animas County Health Department with the Colorado Trust Foundation. And then Mr. Reznicek said, you ought to have 10 more days available in case they want to come back. And we did that. We set it up in a grant program to where we could help an additional 10 days if needed, and at no charge. And because we're underserved and the frontier counties, that was hugely helpful. And just for an update, in 2024, we served 3 from Los Animas County that went through the program all the way to the end, and 4 from Huerfano County. So it's working. No insurance is required, and there's a no wrong door approach. And I'm not like all these other guys that have something I can put up there. I'm IT challenged, so I got it all written here. Bear with me. So we have free counseling services and up to 10 free telehealth counseling sessions with licensed professionals. The first 6 sessions are funded by CAMP. The next 4 is the Colorado Health Department, the Colorado Trust Grant. And they're bilingual. They're available in English and Spanish. They're agriculture worker friendly. The counselors can identify. There's easy access options. Residents can connect from home using their own device, from a private space at the health department, Trinidad and Wilsonburg, by checking out a tablet or a jetpack and then using a hotspot if needed. We're trying to make it readily available any way we can, because we're trying to keep it on the down low, incognito. That's why the MAP van approach. And you've seen my presentation on the film. You know, everybody knows everybody in a small community. They know your white Dodge that's got the green fender and the border collie in the back, and they know that's you. So we're trying to keep it as incognito as possible. So for instance, at Los Animas County, we had it available at the fairgrounds for a while. That way they could go out to the fairgrounds, nobody's going to see what's going on. And agriculture people are very private, and we like to keep our problems to ourselves. We'll get through it. And but this was a way to allow them, if they figured they needed help. If they had an opioid addiction, they could help with that. And we offered other services out of these MAP vans, not just for mental health. At the time, COVID, we could give COVID shots there, we could, assist in many different ways through that MAP ban. So it wasn't, the stigma wasn't like, there's the mental health ban, you know, no, that's not what it was. It was to help with all the vaccines that you needed or whatever. We have, special use services, an iMatter program. And, same deal for the kids, parents help enroll kids under 11, 6 sessions free, and they may receive 4 additional sessions through the health department. Over 6 free sessions with ag-friendly behavioral health professionals, and like I said, services are anonymous and accessible remotely. Additional 4 sessions funded by the health department in camp. And that's it. That's what I got.
That's really great.
That's awesome. Thanks, Tony. I'm curious with your role, as the county, you're still serving as county commissioner, is that right?
Yeah, I got 1.5 more years.
Oh, nice. You know, you gave a couple of statistics, but down in your super dispersed Los Animas County, which you were describing earlier, how broad it is. How are you guys able to engage with the folks that are out frontier so remote? Because I think you and Connie live way, I think on Legacy, Connie says you're like 45 minutes from the grocery store or something, right?
We were, and that was real close to where.
Yeah. But how are you engaging with these folks, or how do you guys invite them to, you know, participate? JC had to leave, but I know that the Coffee Break Project's kind of been a model of getting super folks together. Yeah.
We, the map van made it real helpful. We
Yeah.
could go to them.
Yeah.
And, you know, we're 128 miles from one side of the county to the other, just from Trinidad alone to Kim, Colorado, which is the last town in my district. That's my district, is 58 miles just from Trinidad. So, and it's 40 miles to Lahanas. So they'll be bringing us in Lahanas. So we had to go to them.
Yeah.
And, but some of those people participate in his coffee.
Oh, yeah.
I call it the coffee clutch. Some of those people.
Yeah.
Participate in that.
Yeah, because I know that's a challenge to reach all these folks that are so far away.
Yeah.
And do you guys have is Los Animas one of the counties that doesn't have its own hospital? Do they have to go to other?
No,
counties? You have a big.
Great hospital.
Oh, okay, nice. I know that a couple of those counties that are way out there they have to go to other counties to get to a county hospital.
Yeah, no, we got a great county hospital. We've got 2 health clinics.
Oh, nice.
And, yeah, we just put a new wing on our hospital, so, yeah, we're doing well.
But even with that, if the hospital is 100 miles away from somebody, they're having to make a big effort to get there.
You know, I can identify with what Maddy was talking about, when you live that far out. And, you got animals that need you every day. You're chopping ice and feeding and that sort of thing. You'll let your ailments go to take care of your livelihood, because that's putting your kid through college,
Right.
You know, that's gonna feed them next year. And, there's a banker that's looking at you that's, saying, hey, you got an operating note that's due in December, that's due in October, whatever. So myself, I went 1.5 years after I broke a knee replacement, and I didn't go in, and then almost lost my leg because of it, because I had gangrene in the knee joint. And so I've had 3 knees in my left hand and 1 in my right. And both shoulders and elbow and wrist. But all of those, they go on the back burner until you get the work done down there. And I'm really glad she's up there living that and experience what really happens out there, because people don't understand. His dad, his grandpa, the same way. We would go put all those little ailments to the side. He would actually had a horse follow me and break a leg. And they said, you want us to load back and get the pickup so that we can take you to it was 6 miles back to the pickup, and it's 8 miles to where we were gonna drop the cows off, right above his house on what we call Epperson Mesa. I called from there with a buddy's cell phone and had my wife come to meet me there. And so you put it off for 6 hours with a busted leg that's doing this and you're horseback. And so, yeah, I can,
You can relate.
yeah.
Yeah. Well, thanks. Anybody have any questions or comments about the camp program or what Tony shared before we break for, I guess, comments and then lunch?
Well, I think more than just the camp, I'm really impressed, Tony, with the thoughtfulness and intentionality that both those counties approach this from. And not a desire to just recreate the wheel, but to look at what are existing services we can supplement to better meet the needs of our counties and the range of options that they've worked to promote. It's really inspiring how they have looked to be responsive to their community and be very focused on really quality solutions. So it's a fantastic model.
Well, and I hope that, now with Sally back at USDA, I hope that, and I'm gonna try to talk to her. I'm gonna see if she'll reinstitute that program, because that would be great to have that mat van service again. Those funds run out and then you had to look for other funds to really continue. And at one time we had 2 of them. And that way we could, we could spread out our services even more, but mental health, professionals are few and far between and that made it a lot more amenable.
Yeah, I love the tablet program too, that people can check that out so that they can have those access.
Yeah,
in
a hot spot in the parking lot.
Yeah, that's great. And where do people grab those? At the health clinics?
Yes.
Yeah.
Kim Gonzalez, we have Team Los Animas County, we have Michael Aragon, and we're talking about the legislation that was passed. And all the individuals that took part in that, I wrote them down from CCI. I wish he would have stayed here just a little bit longer, but Kim Gonzalez, our health director, Michael Aragon, the Department of Human Services director, Jennifer O'Hara, I believe she's from Adams County, was part of that and helping push that through. And Felix Lopez and Carrie Warren Gully. They were great voices in getting that bill through. I wish I could say I was, but the reason Los Animas County has been as efficient as they have been, we all stay in our own lane. And because Felix was with Salute and the director of Salute there in Trinidad, let him take that lead, and I kind of stepped back from that, but I still kept my foot in the mental health.
Nice, well, thanks for advocating. Yeah. And thanks for making the trip to join us today, Tony.
You bet, thanks for having me.
Yeah. Okay, so JC, we need to do a minute for public feedback. Is there any comments or questions?
Yeah, so there's no questions, but we'll open it up if there's any public comment. And if you do, just raise your hand or let us know in chat. It doesn't look like it right now. But as we're waiting to see if there's any public comment, Tony, is there an opportunity for us to re-engage with CCI to do more, I know you've been very involved there and Greg Felt has really got me engaged on the water part of it, we're having water panels a lot now, but do you think we can do the same thing in the mental health arena?
Absolutely, and I got one more year there too, and be done, but yeah,
we should reach out to them and see.
Yeah.
Good, okay. I don't see any public comment.
Okay, so with that, we'll adjourn for about 45 minutes for lunch.
Yep, so everybody online, we're gonna adjourn and we'll reconvene at 1 o'clock. How's that?
Sounds good, sounds perfect, thank you. All right, Rosie. Are they, I'll just keep myself on new staff and put a little muscle in. Love grease.
I'll make you a co-host so you can share your.
All right, welcome back, everybody. Tim and everybody in the group. Chad's gonna leave his computer going so that I can hear myself and it'll drive me.
We should all turn up our volume. Could you
Turn it up.
we all did?
No, that would be the most terrible thing. That's like my nightmares were made out of.
Voices in my head.
So for this first part of the afternoon, we're going to jump into subcommittee reporting and just kind of an update on the goals, the work plan that the group put together when we first got started. I am hopeful that we can figure out how to engage some of the folks that haven't been able to attend as many of the meetings so that we can get some active participation through these subcommittees. But Chad and Catherine and Robert and I have kind of taken over for Calandra, and I will take more ownership of that outreach committee moving forward. But just kind of, we made some time so that people can wrap their head around what those work plan goals were, kind of what the approach from Chad, Catherine, and myself will be, and how we can engage those going forward. And with that, I think we can just jump in. Feel free, if you're part of the general public, if you have questions as we're going along, continue to remember the question and answer function on the Zoom call, and we will be responding to those as we can. And obviously, Tim, right now you're the only person online with us, but if you have a question, just come off mute or wave your hand or something. And with that, Chad, are you gonna share your screen? I think you said you were fancy and got some slides together for us.
Fancy.
You're making the rest of us look bad.
Definitely.
I just can't track it all in my head, so. All right, let's. So one of the goals of this work group was to identify best practices for behavioral health care in agricultural communities. So I volunteered to take part in that, and it's a little bit of a challenge to look at best practices. Typically what that means is evidence-based, and I'll talk a little bit about what that designation means. And kind of what we're up against is that although in some ways behavioral health support's been going on in ag communities for a long time, it hasn't had enough rigorous evaluation data to determine that it's an evidence-based practice. So just from the onset, like I think we have to just accept that's not where we're at, but there are some things that we can learn. So what I want to cover today is that there are two systematic reviews, systematic literature reviews, and what those mean is that it's a structured, transparent, and replicable method of identifying and evaluating a wide range of peer-reviewed scientific articles. So a systematic review follows a predefined protocol and aims to minimize bias. So all that to say, it's more than just myself reading through a bunch of articles. I wasn't part of this. There were two systematic reviews that basically cover everything from 2002 prior. And that is like the largest sort of data set that we have to be able to look at. So I want to share those two studies and what those look like. The first one is Farmer Mental Health Interventions, a systematic review. And I can't remember in our last meeting when I brought this up, if we shared links with this or not. If not, I'll be glad to get it to you. We did share them?
I don't think we did.
Okay, all right. I'll send links, so if anyone's interested in getting into the actual, they're pretty long. But if you're interested in those details, I'll be glad to share them. So the first study we'll look at, this reviewed a wide range of mental health interventions targeting farmer mental health, spanning over 50 years, and examined the reported effectiveness and constraints. There were a total of 92 articles on farmer mental health that were included in the final systematic review, because there are certain criteria that have to be met to be included. Most of these articles are written concerning mental health literacy, which is about sharing information and paraprofessional support interventions in the United States and Australia. Australia got kind of a jump start on farm stress outreach. And so there is a pretty good data set from them as well. Paraprofessional support really means non-clinical support. So it could be a better equipping anyone in what we would consider like ag adjacent roles to be able to help and support our producers. So the mental health and crisis literacy programs were the most common and the most evaluated components of the mental health literacy interventions. And that constituted 46 of those 92 articles. Mental health and crisis literacy, particularly stress management workshops, described as key components of the vast majority of multi-component interventions in the United States, Canada, during the farm crisis and other times of crisis.
Hey, what was the time frame right there if it's talking about the farm crisis?
This one goes all the way back to I think the 1950s was the
Oh,
earliest study.
well, okay.
So one of the things that is helpful, it's a little bit hard to see from here, but could help shape future efforts. It looks at the components or drivers of farmer mental health. It looks at physical health. Tony gave us the example of his knee earlier, and how most, producers are driven to deal with whatever you've got going on to make sure, like, I will walk with a bum leg to make sure that my cattle are fed or my corn gets harvested. So physical health is obviously huge. Financial well-being, social support, coping skills, assistance and referrals during crisis, and culturally appropriate and available care. So from all the studies they looked at, these were components that were part of it. So that's worth noting. Some of the other key takeaways, only 56 of these studies reported empirical data. Only 2 used what's called randomized control trials, where you look at randomly breaking up people into 2 groups. One group that gets like the specialized treatment, the other group that gets the normal sort of treatment. And to look at, is there an actual outcome if you change a certain variable in there? That's what establishes whether or not someone is considered, or whether or not something is considered an evidence-based practice. And that is a big step to get to that point. So there's not a ton of super helpful data, but non-experimental and qualitative data suggest positive outcomes from literacy and peer support programs and some community-based and agroecological interventions. So that's a lot of words, but what that means is even in the absence of really hard data, there is data to suggest that you can get positive outcomes from everything from just sharing behavioral health information, leaning into the peer support programs, community-based programs, which I think of like COMET, or equipping communities to create their own safety nets and better recognize and respond to signs of behavioral health. And then agroecological interventions really have to do with supporting the actual environment that our producers are in. So this could be something like getting out on someone's farm, doing the things like AgriBility does to assess whether someone needs assistive technology or adaptive equipment. It could be some of the groups around the country and maybe other parts of the world that go to farmers and ranchers' homes and provide financial assistance or teach them how to better, keep record keeping that matches their Schedule F tax forms. It could be any number of things that are specifically geared towards making a difference in that producer's actual environment. And then the authors call for stronger, broader evidence, especially around multi-component holistic programs, more targeted evaluation. So all that to say that what Catherine's going to talk about in terms of looking at outcome evaluation, the more that we can set up whatever efforts we do in a way that we can actually measure our impact beyond just butts and seats is really what's in our interest. So the next study, this is smaller in terms of the number of articles. It's called Potential Directions for Farm Research, a systematic review of educational interventions to reduce psychosocial stress amongst farm and rural populations. This is not a title that rolls off the tongue. I apologize for that. This one only reviewed 22 educational articles, but it started with almost 1,000. But to get to the actual criteria that they needed for this, it narrowed it down to 22. So some of the things that they came up with or looked at through this is that they found 22 intervention studies focused on reducing psychosocial stress amongst farm and rural individuals. So this is a much more targeted review. And it explicitly excluded clinical professional treatments from therapists around things like CBT, treating depression, stuff like that. It's looking at more like accessible intervention strategies that you could use to reduce psychosocial stress. So one of the things they found is that virtual delivery appeared most promising, with 4 out of 6 virtual interventions showing meaningful impacts. It doesn't mean that face-to-face wasn't impactful, but at least the limited amount of data they had suggested that virtual delivery does have some benefits. Thus far, research supports the use of educational interventions, but it does not support a specific intervention design. And then future research should first identify the population-specific causes of stress to develop primary interventions, which means that we need to be really tapped into our state, the struggles that our producers are facing, and maybe something from Kentucky, we could borrow elements of it, but it may not totally match. So towards this end, we're in the very early stages of this, but we're working with our CSU faculty members. The hope is to send out an actual paper survey with a $10 bill. It's, Clinton and I have gone a little bit back and forth on this. Incentive, it's a paper survey with a $10 bill to get people's input on the stressors they face, specifically producers. And the idea is to send it out to 1,000 producers in Colorado with the hope that you could get 30% response rate, which would give us about a 300, in theory, hopefully, data set of 300 producers, views on what their stressors are. So that would be helpful in designing some interventions. It's again in the early stages, so we're ways away from it. But some of these recommendations are things we can take into account for how we may want to structure and put our time and efforts as we go forward. The research also suggested that secondary interventions could include community-based initiatives. I mentioned that in the first study as well. So anything to help facilitate open conversations about stress, depression, and suicide. Most of the outreach that all of us are doing is already geared towards that anyway, so it is beneficial. And then tertiary level interventions such as improved access to healthcare professionals continue to be of value. And we talked about a number of those examples this morning, from what Julie's doing to Tony in the 2 counties. There's a wide range of things that are being done. MJ's work, you know, lots of places where we already have boots on the ground doing some of this stuff. Yeah, Matt, you have a question?
No, I just did the math. I thought maybe you should just buy a John Deere ATV and make the successful respondents part of a lottery.
There you go. I like that.
Or a Kubota. I mean, whoever wants to throw the device, the equipment in for free or whatever, then your name gets thrown into the lottery.
Yeah, I like that too.
Instead of the $10, that's an idea.
We have to get it through the university, what's called internal review board, which looks at the ethics of your study designs. So if we get shot down on the $10,
you go with plan B.
Yeah, I like that. That's good. Right. So some of the other key takeaways for this is the need for high quality research of intervention effectiveness for stress reduction. Groups who support or live within the agrarian communities are an important key to the development of feasible interventions. This comes as no surprise to most of us, but I like the fact that one of the 2 major studies here points to the importance of working with groups that are involved in ag and making sure that they are partners. So we are doing with, not doing to. So that's important. And then development of measurement tools to target farm or rural stress specifically, and coming up with consistent outcome measurements should be a goal of all future research. And we've already got that built into this, and Katherine will talk a little bit about that here in a second. So what do we do with all this? I would propose that based on these studies, this gives us some direction. I can continue to review studies published 2022 to current to look at what are the ones that have the best sort of statistical design. Not that we're gonna copy, because I think when I initially signed up to do this, I thought maybe we'd be able to come up with a list of 10 programs that have the evidence backing that we could adapt and look at how we could do that in Colorado. I would ask this work group to accept that there may be no smoking gun in terms of a specific program, so we can just take already prepackaged and drop on Colorado. And even if there were, I don't know that that's the best way to do it anyway. So if I could have people's agreement to kind of accept that, then what I would propose from there is that we do look at, from all these studies, even if there's none that say this is evidence-based, the most effective sort of tailored intervention we can do to best support our, the behavioral health of our agricultural populations. What we can do is compile the most reliable recommendations from all the studies just to create a guide so that as we look at doing things as in this work group, that we can at least check as many boxes, such as involving local ag groups, making sure that it's as culturally relevant and responsive as possible, understanding that what ag looks like on the western slope is different than what it looks like on the eastern plains. And then, you know, we look at the different subgroups within our farm worker communities. There's a lot of places where we can tailor things, but I think we can benefit from what's been done to make sure we're not totally reinventing the wheel. And if our overall goal is just to come up with sort of best practices, if that's not specific best programs, then we can still find some guidelines to help act as guardrails on the road to keep us working at least within what we know from the evidence, to try to align with that as close as possible. So that is what I have to report so far, and if we do get to that point, then I would suggest updating it annually based on new research and feedback. So that's kind of where we sit with best practice review.
On that last bullet, is that an invitation for folks if they come across any articles or whatever to send your way so that we can start collecting those?
And I had put that as one of the things in the SMART goals, so we had to create when we first started this. I also put in there that we'd find a list of 10 best programs and then run that by ag invested, whether it's ag organizations or behavioral health organizations or whatever it is, to see the feasibility of that. So I'm saying we don't have enough to do that step.
Yeah.
We don't have 10 specific programs we need to review for feasibility. But again, I think we can reasonably come up with a guide, taking the best recommendations from all this data to help at least inform the decisions and efforts we make.
Yeah, I love that. And so, Rosie, I don't know if in the follow-up email or whatever, if that can be an ask, and if we can create a folder or whatever, where either people could deposit stuff so that Chad doesn't just get an inbox full of random stuff, but that people can start putting it someplace.
Great. Google Form. Yeah, can make a Google folder.
Wrong guy.
Can upload it, or they can email me and I'll upload it.
So we have a question online. Is CSU or another institution participating in a study of the effectiveness of Colorado's approach? Does Colorado have money to pay a university for that research?
Good questions. So Colorado doesn't have to fund that. We've been able to get a number of grants to look at increasing the outcome evaluation data for things like Land Logic, which is our 3-hour provider training to help behavioral health providers better work with ag populations. So we have external funding that is supporting those efforts. The CAMP program that provides the 6 free hours of therapy for ag populations. We also have external funding there to help begin to look at evaluation data and also a randomized control pilot study to look at the difference in effectiveness between 6 sessions and 10 sessions. So because of these external grants, we've been able to partner with our CSU faculty members to increase some of the research pieces without it costing the state anything. So for the first part of the question, we have a long ways to go in getting the data, and we're still in the design mode for some of this, but it is not costing the state anything. So hopefully that helps answer that.
Thank you.
Yep.
Any other questions from anybody in the room for what Chad presented, or from anyone online?
Chad, I have a question. This is Julie. You had mentioned having found some information from Australia. Have you looked at anything from Canada? I'm on a couple of website things that come from Canada, and it seems like they are working on programs just like we are. And so I was just wondering if you had found anything.
Yeah, Julie, so Canada's efforts were captured, particularly in the first study. And again, that's only to 2022, and I think Canada's really hit a different pace over the last couple of years. So I do want to look specifically at what sort of lessons they've gained so far, and I hope to use some of that to compile that into the guide. So I feel like, and we've had groups reach out from the UK and France and different places, even South Africa, to look at what are some of their efforts and what can we learn from each other. And if we can avoid reinventing the wheel, recognizing that even in my own sort of personal experience from talking with like taro and quail farmers in Guam to producers all over the country here, there's very big differences and there's very big similarities. And so to whatever extent we can learn from each other, specifically around program rollout, what's effective and what's not, we definitely want to try to do that as much as we can.
Thank you.
All right, before we move on, Richard, I want to welcome you to the meeting. I know you weren't able to join this morning. And would you be willing to just introduce yourself to everybody? I know that you've done that at past meetings, but before you got here, we all introduced ourselves. And so for anybody who's joining, they can have a context for who you are and where you're joining us from. Because I know it's not that beach that's down behind you.
Oh, yeah, I definitely picked about the most opposite background I could find. Work in the desert, but yeah, my name is Richard Harlan, and I'm a mental health counselor, substance use counselor for the Ute Mountain Ute tribe. We're a reservation here in the Four Corners area of Colorado. We're as southwest as you can get, and the reservation goes all the way to the Four Corners border. There's three bands of the Ute tribe. There's the Southern Ute, the Ute Mountain, and then there's the Northern Ute, and it goes over into Utah. I really like working out here with the Ute Mountain people. They're very proud people. We've got a very big farm and ranch operation, part of the tribal investment. So I'm looking forward to getting some numbers. I'm not sure how many people actually work in the whole farm and ranch enterprise. I'm really looking forward to doing a little more outreach with those guys. But we've got fields where they grow the crops. I mean, we also have a cattle operation. So they have all those farm workers. We've got, the ones that maintain all the irrigation. And then we've got a mill that processes the different grains. So they're out there in the mill, processing, bagging. We have transportation then that works to, load up trucks. So we really do see, I feel like the whole operation, within the agriculture community right here on the reservation. And then we experience, I believe, all of the problems that everybody else does, in the agriculture community. It's dry out here. Water's a constant, concern.
Well, thanks for joining us, Richard. Glad you could be here this afternoon. And yep, we're gonna keep moving here. Katherine, I will invite you to share about your subcommittee.
I'm just leaving because that's when I start talking.
That's brought up trauma from your past.
But thanks for letting a guest sit in.
Thanks for your time.
Thanks for coming and joining us, man.
Got to reacquaint myself with some old friends, but I'm gonna keep in touch with Robert, okay?
That'll be good. Yeah, safe travel that night.
Got some salsa?
Yeah, you got some.
Good.
Cool. I don't have slides because I was in Mongolia.
What?
That's
a reasonable reason.
I didn't even know like that.
not what I was doing while I was gone. Robert, I actually shared with you just in your email a thing that I will want you to bring up. So while you are looking for it, I will talk a little bit about what our data subcommittee has been doing. We sort of have a longer name than that, but none of this is official, so just call it the data subcommittee if that's fine. The goal of our subcommittee is that by December 31st of this year, we will compile data on behavioral health outcomes in Colorado agricultural populations. We will identify assets and gaps in improving those outcomes, and we will identify potential policies to address barriers. So super small list, right?
I love that.
So I have sort of like two things that I want to talk about that we're doing today. Our subcommittee has met one time so far. Our next meeting is on Friday. I don't remember when, but it is on Friday. Hold on, I can check my calendar and actually tell you. Let's see.
It's at 11.
It's at 11. Thank you, Rosie. And we can send that information out afterwards. Richard, I know that you wanted to join data subcommittee, so I'll make sure you in particular also get that link. Perfect. Can you scroll down for me, Robert? Keep scrolling. Okay, yeah. Keep it right there. Thank you. So the two things that I was going to talk about with the full group today, is one of the things we are currently working on is compiling a list of data sources for those behavioral health outcomes that we want to know what they are. We are also specific. So when I'm talking about outcomes, like actually scroll up a little, Robert. Sorry, I'm just gonna make you be my little hamster. That is some of our outcomes that we have, that we're like, this is maybe things we should find out if this data exists somewhere. So stuff about substance use of all kinds, overdose, depression, anxiety, suicide, PTSD, all of those other things. This is all stuff that we were like, this seems like it's relevant and we should find out if there's data for it. Okay, scroll back down to number 2. Thank you. So Chad and I sat down together the other day and we're like, okay, now we need to figure out like where this data might exist. And my ask of you guys is to look over this beautiful list that we have. This is the things that we thought of here is stuff that we might be able to pull this information from if it exists. So this is all stuff I will be looking into. You can see we have the Western Regional Agricultural Stress Assistance Program, Western Region Reports. We have a bunch of Colorado Department of Public Health and Environment data. That is my department, so that's all anything that we have data on, I will be looking into. That other stuff is also CDPHE. We have the Colorado Rural Health Center does their snapshots of rural health every year. We're going to be looking into that. I have Behavioral Health Administration ? Because I don't know what data they do or do not have. I don't think anyone from the BHA is on today, so I will try to follow up with Megan from the BHA and see if she has anything. And other than that, the sort of like random hodgepodge of things we have is looking at the Colorado Broadband Office for those questions about internet access. CSU Extension has some surveys that they have been doing that we will hopefully be able to pull some stuff from. Kathy James presented a couple of months ago at this work group meeting about her farm worker study in the San Luis Valley. And then we're also just going to trawl around in the Rural Health Information Hub online to try to find anything. So my main question to the folks in the room and online, like, are there any data sources that we are missing that you're like, oh, hey, this has like farmer and rancher data that might be pertinent that you guys should pay attention to when looking at outcomes for people? And if it's a no, that's okay. If you want, it's like one of those things where we're just like, we don't need anyone to be Googling around at this point. We're just like, did we miss something that people can think of?
I don't know if it's encapsulated in there or not, but we had a presentation, I think it was an extension forum last year, maybe the state demographer came in. And there's a few really interesting things that we've used in our work since then, around like folks with Spanish as a primary language in those communities. I think that might be helpful because they look at, services in different counties. But then there's also some good data around like migration of different counties, and those populations are growing and shrinking. That might offer a little bit of context from some places. I think it's all the state demographer's office.
Yeah, thanks. I have had the state demographer on there for like internet stuff, but not for those other things. So thank you.
I didn't even think of Spanish orgs, maybe they collect some time.
Yeah, yeah, if you're able to find any, let me know. Anyone online?
So I'm not sure, but I usually look at SAMHSA. They usually have a ton of data, but I haven't looked for this specific set of data.
Okay, thank you.
I'm about to post a link. I'll post it in the chat here, but the American Farm Bureau Federation has a page called the Farm State of Mind, focusing on this, and there's a lot of different places and things you can click on. So I'll just post in the chat for you so you can click on that and take a look.
Perfect, thank you. Okay, sweet. And then you can just stop sharing your screen, Robert. And then, of course, if anybody else has anything else that they're like, oh wait, this occurred to me, feel free to email it to me at any time. And then the second thing I want to talk to y'all about is one of our other things that are doing. So we're like looking at these specific data sources that already exist and pulling data from it. And then the other thing that our subcommittee is doing is that part of that goal to identify barriers and community assets for behavioral health amongst ag folks. We're planning to survey and or interview ag producers and workers on the topic of behavioral health. So our vague notion right now, which we will be fleshing out more in a couple of days, is that we'll probably have a survey that we will ask work group members to distribute among ag people that you know, to fill out. And then we will probably be doing supplemental interviews. Again, we're figuring out like the specific logistics of what makes sense and what doesn't, based off of the existing data we already have. But my main question to the group is, as we're sitting there and compiling this list of survey and or interview questions to ag folks, what are the questions that you guys would want to be asking them, especially thinking about, right, how we may have some of that data on specific outcomes that I mentioned, but also of the stuff that, like, if it's not showing up in there, but you think it's important, we be asking people about it. So we are collecting information. I would love to know specific questions you would ask people, and I will write them down right now. Then we'll use them on Friday to make our survey. While you think, I'm gonna look for my ring that I found on the ground. I found it.
I might like to know what resources they're already familiar with in their community, if any.
Awesome, thank you.
Okay, are you familiar, do you have a way to get to those resources?
Do you have a way to access those resources, and like what are barriers to accessing them?
That's what I was wondering, just the general question of what keeps people from engaging in behavioral health support.
What keeps people from engaging in behavioral health support?
I think perception might be really interesting. What are survey participants' perception of the level of availability of resources? Because then if somebody thinks that they don't have any, and then there's a ton, you know what I'm saying?
Right, then you know that it's like a
crossover,
like an education problem.
versus-
Yeah, that's the creating something. Yeah, I love that.
Then there are a number of normed and validated scales around help seeking attitudes and stigma perceptions specific to ag populations that you can sort of pick and choose questions from. We've worked with some of the faculty members to look at which ones make sense for what we're doing, so I can share that as sort of a bank to draw from. We can also look at what we're including in some of these other surveys, so.
Yeah, language is gonna be very important. You don't want to read a question and they're like,
Right.
Probably something like, do you have experience in seeking behavioral health or mental health? And if so, then what was that experience like?
Perfect.
You know, referencing Dr. Kathy James, stuff I think will be helpful, because they really were comprehensive in what they were asking. It wasn't just behavioral health, it was all across the board. But also reaching back out to her, Catherine, because I thought she said that they were in process of expanding their research to other parts of the state, and I can't remember exactly where she said that they were wanting to do that. So they might be a great partner with collecting data.
Awesome.
And then the other one that I don't feel like that there's a whole lot of data within agriculture, but it's the whole social connection piece, like what organizations do you belong to, where do you get most of your, information around things in agriculture, where things are, availability. I just continue to want to know where people connect with other people in agriculture, particularly like we were talking about earlier in these really low population counties that have so much land access and the people are so isolated and alone often. How do they stay connected?
Maybe ask, what are some of your stressors? Right, is it, because for a farmer, that stressor is gonna look different than a farm worker. Farmer's probably worried about his crops and the government. A farm worker is worried about just eating that day.
Yeah.
So.
And the government.
And the government, especially the government. So what are the stressors, and maybe kind of gauge those answers, where do they meet in the middle?
Yeah.
Leaning on folks with more professional experience in this realm. And for you, Catherine, how much logic can be built in this form? My question being, talking about, levels of change and pre-contemplation, contemplation. If somebody is not experiencing stressors, just for example, right, if somebody's not experiencing stressors, is there a way to work
That then
through
you're not, like,
like a
working
level
through,
of
like, five
questions that hits on that?
Yeah.
Because if somebody's never thought that, I have, I need these resources, if they've never thought about that, they're gonna answer a question like that very differently.
Yep.
Is there a way to build in that logic that
Yeah.
works through those stages?
Yeah, there will be, and I think that's part of what we'll be thinking through, like, how are we doing this of how much is survey versus interviews, or do we even do survey and it's just interviews or whatever? But I'm making a note to myself to do that, because I think that's a great point of, rather than having them walk through a bunch of extraneous questions that specifically do not apply to them. Making sure we do that, which is definitely possible.
Now, we do think of just, like really sharp data rather than somebody who's not experiencing stressors saying, or just guessing. And that.
I mean, everybody experiences stressors. I think they just don't have a name for it.
Sorry.
Unless somebody lives in a happy bubble at all time. That would be sick. Let me know where they at.
That's really true. I do a lot of assessments. And if I just start out by saying, have you experienced trauma? They're always like, no. And then I get further in the assessment and they talk about all this trauma.
Yep. And I think that's the disconnect, that they don't have a name for what's been experienced and what's been suppressed, and oftentimes with trauma, what you push to the side to not have it resurface and play out in your life. So again, I think those stresses are gonna look very different. And we don't want it to be an interview, but if we do have to approach it and be real about what we're asking people to do. We're asking them to take care of their health, behavioral health. The only way to do that is to go inside. Why are you acting like this? Why are you coping this way? Come on. So. thanks for
Also
that.
knowing if they are new to farming, or if they've been in farming, or if the farm was handed down to them, kind of thing. Assuming that maybe the stress that they would be feeling as a new farmer would be, one thing, and then the stress of having a farm handed down to them type of thing, is that a different type of stress? So kind of like, I don't know if Tony Haas is still there, but kind of like he mentioned in the legacy video of having a farm handed down. And that stress of, can I keep it going?
Yeah, thanks, Julie. Tony is still here. He's just quiet
Oh,
in the
good.
corner.
Sitting here and I'm taking this in and we're thinking about the one individual that's the subject of this conversation, but how about the mother and the kids? They're stressed because he's stressed. And my kids Trists don't want anything to do with the ranch now. After fighting Pinyon Canyon and the droughts and the blizzards and, you know, the financial up and down, they don't want anything to do with the ranch. And the stress I put on them because I was stressed out and my wife, bless her heart, she had to put up with all that too. Yeah.
It's pretty cool, Mr.
Mhm.
Yes. Very real.
Yeah, and that makes me think too about what we can be doing of incorporating the family perspectives.
Yeah.
And on the other end, I'll share a story. There was a guy that came, there's a man that he was smuggled from El Salvador, chasing the American dream. He ended up in a farm and he was not aware that he was gonna do butchery. So the slaughter of hundreds of animals and the repetitive motion left him messed up. So I never even thought of that, like, right, like, we just get the food and we eat it, but these people that are, I wanna say these farmers, these ranchers that have to deal with this, right, like, what are some of those stresses? What do you see there when you're prepping the food, prepping the meats? And the crops, we know it's the heat and it's the extreme temperatures that they deal with. That's a different kind of stress, but to be slaughtering animals hour after hour after hour, that's gotta do something to you psychologically. So I thought that was a pretty good point because I had never even considered people that work in slaughterhouses or the fisheries. They brought up fisheries earlier. A lot of that goes on there too. So maybe asking questions around like, what do you do on a day-to-day basis at the farm, right? Kind of get a better gauging of what those daily activities look like and start piecing together. Go ahead.
There's one lady on here that's from the northwestern corner that was the sheep. That followed the sheep around and now they're dealing with wolves and predators. Just predators in it. And you think about what people have to go through. It's not what actually happened that day, but what might happen. And they're living with that stressor constant. That is never ending. That's
Mhm. Which is your
Yeah, that
daily.
is a one.
Go ahead.
Cool.
and for her, it would be bears in the springtime.
Yep.
When those sheep are lambing, yeah, it's bears in the springtime.
Or for example, where my sister lives, she still some deep and it's the bald eagles. They have 4 nests of bald eagles in their area that come and grab a lamb every so often. So that's a stress for her. She has to watch. So it's not just stuff getting them from the ground, but it's from the air too, type of thing.
I used to live in Rock Springs, Wyoming. I know all about that.
Oh, yes, you do.
Cool. Thanks, everybody. That's super helpful. I have a long list and I have a couple of other questions for you, but again, if other things occur to you that you're like, hey, ask people about this, feel free to come talk to me directly. Next general question to the work group is that of like the actual interviews that will happen, right now we have Mike and MJ will be the people conducting those. I just wanted to put out a general ask of the group, is anybody else interested in helping conduct interviews? You do not have to say yes, but I didn't want anyone to feel left out, like, what, they're interviewing people, I wanted to do that.
Do you have an idea of how many interviews?
I don't, I think it would be however many you wanted to do.
Anywhere from like 1 to 1 million?
Yes, exactly.
That's right. Robust data.
I cap out.
Was that a volunteering or not a volunteering?
We'll take that as a tentative.
I can do up to 1 million, but
Cool, well, that is still in the process of getting figured out, so I will probably mention it again at a future meeting, and if that is something that people are somewhere like, damn, I wanna help interview some people, let us know. And then the final question was again thinking about, we're still figuring out this like survey versus like interviewing people and how much is what part and whatever, but I just wanted to ask the group if there's anyone in particular that you're like, yeah, you should definitely interview this specific person, if there's like, and I think of like Tony and how like you, Tony, we're gonna interview you. Sorry, you're already on my list. But right, but like the same sort of, I am a person who talks to a lot of other farmers and ranchers or whatever, like anybody that has like wide social network that you feel like this person would like be especially good to talk to if you're interviewing folks where they know what a lot of other folks who are also in ag are experiencing. That's what I'm wondering as far as if anyone has nominations.
Tony, Tony, come on, I'll make it fun. I'll bring good. Whatever.
How much are you paid?
With cookies.
Cookies.
With cookies, I paid 10 cookies per answer. You have a good perspective, and I think a lot of farmers and ranchers may not be where you are in the awareness piece, but they know something's wrong, right? Like they cope and.
This guy will be real good there.
Yeah.
We were neighbors, so at the same time experiencing the same fluctuations in weather and financial burdens and trying to pay for a place. Yeah, he gets it too.
I know Larita stresses a lot about horse feed and the vets. And like that is her biggest stress. I mean, she's got kids, everything, but like the feed and the vet costs. And I'm just like, I wish I could help. I wish there was more foundations for the animals. But yeah, like there's a lot of different stressors.
We're really passionate about our animals.
Mhm.
I took my son with me everywhere I went, and he had an effort that was gonna cap right before Christmas Eve. And I said, oh, we're gonna have a root off tomorrow morning. And we go out there to feed the next morning. And the coyote had incapacitated the cow and ate the bag off the cow.
Oh, no.
A pack
Oh,
of
dear.
coyotes. My son declared war on coyotes, and he was like 9 years old. Those are stressors.
Mhm.
Yeah. Trauma response. Yeah.
And trauma, yeah. Ugh.
Well, see, we can pair up with some up and coming tech people and then see how we got serious. And like, what about electrical fences, stuff like that? Like, where can we find help in our networks and our community to like solve these problems, right? Where can we put, I don't know about the eagles. I don't think that you do anything about those eagles. But at least we can shock a coyote or two.
Yeah. Did you say shot?
Shock. Like
I know what you
shock.
said.
A shot caller?
30 calibers.
Like the past tense of shot.
I guess.
Past tense, yeah.
That's right.
Any other suggestions of people that we would want to put on our interview list?
I had some thoughts about some people that are at CDA. I would want to talk to them first, but would that you be open to have some of them be interviewed?
Yeah, I will write on my list Robert CDA people.
Some of them have had firsthand experiences with people they work with have committed suicide this past year, so I think their perspective could be valuable.
Yeah, absolutely. Okay, on the list. Anyone
I wanna
else?
look at a specific maybe survey set for what we consider the ag adjacent professionals to get that perspective. And also look specifically at producer perspectives.
And I know Matt Hamrick, who was here, I'm sure he would be doing.
Oh, I put his name on here already too.
What do you get for leaving early?
Yeah, it is. You thought you could stay for my presentation? Sorry, man.
Now assigned to 3 different committees.
Yeah. Well,
I think Laura Nagley from the Legacy video.
Yeah.
Would be another really good one.
The crop aspect of it right now with all the hailstorms and everything going through there.
well, got her down. Cool, thank you, everyone. It's 1:50, which means I'm done with this
You
portion.
did so good.
I don't know what we're doing now, but I'm done.
I'm gonna try to represent, Calandra's work, with Robert and Rosie's help. So, any thoughts or questions for Catherine before we pass on? Any questions from online? Robert, anything come through? Nope. Okay. Chad and Catherine, thanks for, organizing that. And I don't claim any, ownership of this. I wish I did. Callie did a great job of passing this off, and this was some work that she did, and so, Rosie's putting it up on the screen for you two that are on the screen to look at. But this was just a, strategy that she had put together before, she left, and we wanted everybody to have a chance to read through it. So for this first page, I think we're just going to, give you guys a chance to, look at it. I will read the mission and vision just because I thought that she did a great job capturing this. So the mission is to elevate the behavioral health and well-being of Colorado's agriculture communities by fostering coordinated, collaborative, and culturally responsive strategic strategies across public, private, and nonprofit sectors. And I'm thinking that she was taking the mission of this whole like group, not just the subcommittee group. And then the vision was for a thriving agricultural Colorado where all farmers, ranchers, and ag workers have equitable access to behavioral health resources, support systems, and community-centered care. So thanks, Callie, for that work. And then if you can scroll down a little bit, Rosie, I'll just let you guys read through these goals on your own. But I think that the idea for this communication and outreach strategy is captured in these goals pretty well.
And that's, as we organize this event, Rosie and I were talking about that I think we have a great opportunity when we have on location meetings that we'll try to do more advanced planning so that we can really interact with the community. Julie, we really appreciate you being here. You know, I think we have like I said, a great opportunity when we go to different communities to really find out what's going on in that area and give that community a chance to really interact with us and expand that reach. So we'll keep that in mind for next time. Normally, we've been building agendas meeting from meeting, but I think for our in-person one, we need to try that effort starting 6 months in advance, so we can reach out to people and have that lined up so people know what's going on. So
and reaching out to more folks like Matt, who are producers in the area that can come and give their input. I think that that's a really valuable voice to have.
So include this in your plan.
Excellent. I will on that note. But no, thanks for saying that, Robert. I think that that really is important. And just to make sure that we're making it as accessible to anybody who's on this working group as possible to get more folks, for those of you that did make the trip, really appreciate it. Okay, so if you turn it over, the core audiences, needs and tactics. When we met last week, we kind of talked through this audience list and we added some at the bottom. But if you guys want to take a minute to just look at this audience list and let us know if there's any major gaps, and then I have an ask for you after we read through these this audience list.
Please forgive my typos. I already see. This is a old granny.
That one did stand out at least. I don't know if we need to add this to audience, but I'm thinking about it because it was in like my little thing for data of subpopulations of interest, because I don't see veterans on here.
Nope.
So I'm wondering if we want to include veterans because there's often that significant overlap.
I think that's great.
Yeah. And I know if Mike was here, he would say that, so I speak on behalf of Mike.
Yep. And you know, the idea here is to be as broad as we can. And part of what we talked about was that within this work group, we all have different relationships, and so much we've talked about in agriculture is that trusted messenger. And so our hope was to invite everybody on the working group to reach out to, or Robert, were we gonna have them reach out, or were we gonna just have them give us the names of people to reach out to? That A, we could invite to the summit, but B, we could start making sure that they were informed of the work that we're doing here. And so if there are stakeholder groups that fall inside this, do you think that, Rosie, we could create like a Google sheet or form or something that could be included that people could just,
like name and contact info?
yeah. How does that sound, Robert?
Sounds
So that we could collect that from folks. The idea was just there's only, well, there's 18 people, which is a lot, but there's so many organizations that we don't know because we don't live in Pueblo, or because we don't live in Fort Collins or in Rocky Ford or whatever, but you do. And so to make sure that we're getting our information out to those folks. And then the other two pieces on here, needs and tactics. The idea is really here outreach and letting everybody in the state that this is relevant information to know about the work that we're doing and know about the resources that are available. And then the tactics here are, you know, kind of just like base tactics that people would use. But if you guys, before we finish up, would just take a minute, read through those and see if there's anything that you see that we're missing, just so that everybody can kind of have their pulse on what's going to be driving this subcommittee for outreach. And so then the last thing on this page is just the idea of the website, and that will drive the data that goes to the website. Rosie has done a great job getting it set up, but just making sure that if there are specific things, events, resources, that we make sure that they're captured there. Summit to communicate with Carlyle and RMFU as they're putting that together. And then any community events that either you're partnering with to put on or that you know about, making sure that those are reported so that we can get outreach information to those community events. So that's kind of what's captured in this page. The other thing I was gonna see, Rosie, if you could pull up before we finish this section, is the working plan or the work plan, that sheet, just so that everybody can kind of see that. And I was hoping that there would be a few people on there that hadn't necessarily signed up for a subcommittee, just to see if there was any place that people could engage if they're not able to. But I kind of think that everybody who's here today is.
Yeah, everyone who's here today is already signed up for something.
Yes.
So maybe those that are, nice job, guys, that are not here, they're gonna watch the video and go sign up.
I got that for you.
Oh, okay. Thank you, Robert. And my eyes are not good enough to see that, but everybody should have access to this. There you go. This just kind of captures what Chad's initial invitation was for his subcommittee, those folks that are there. I really wanted to make sure that people knew that this existed, and so that they could go and kind of track the work that we're doing and the buckets that it's falling into. And like I said, if there was anybody that hadn't signed up to be on a subcommittee, that they would engage, but I can send some follow-up emails to the folks who weren't here to invite them to do that, so. Outside of that, I'm gonna say that if you wanna be on one of these or contribute to one of these subcommittees, you don't even have to serve on it, but reach out to myself, Catherine, or Chad and offer thoughts. My hope with this group is that we continue to find ways to contribute the work that we're doing individually as part of this collective work, and that it's not we just show up and we're waiting on this group to do something great, but that we're able to bring the work that we're doing and report back that this is being done, so that we can realize that this work is being done in all these different areas and it's captured here. Either in the data that Catherine's capturing or in just this collective group that we can partner and collaborate. So Robert, anything else from the subcommittee discussion groups that you wanted us to accomplish before we finish?
No, that was it, really just to get the opportunity for the whole work group to provide comments to each of the subgroups. I guess, I do have a question for Chad on your work in the research side. Are we covering the worker perspective on that research side? The ag worker perspective?
So in terms of reviewing for best practices from workers, there wasn't a lot specifically captured in that 2022 before. There are some, and we've included particularly Catherine's focus with Catherine James research, and then the Western Region Agricultural Stress Assistance aggregate baseline survey also includes farm workers, and they have a separate one for farm workers. So we're starting to bring those pieces in there, but I haven't found yet data that would suggest there's best practices in that, which is not surprising because there's not best practices in the general population. But it should inform our steps for the actual efforts and action. So
great, thank you. Perfect. Yeah, and as a research scientist, I just can't imagine side-by-side studies with people though. Well, you know, how do you do that? That's pretty tough to have a control and one that you're applying a certain treatment to. It's like kind of mind blowing to me.
Yeah. Yeah, there's a lot of processes that have to go in to make sure that someone doesn't.
Yeah.
There's a lot of consideration with
Thank you. That was all I had, Cliff. Thanks.
Awesome. Well, then, we're a little ahead of schedule, but I'm gonna pass it over to you two to give any Department of Ag updates that you might have for us.
We approved the meeting minutes.
Oh, that was something at the very beginning of the meeting that we didn't do, and now we're a couple of numbers down. So yeah, Rosie sent out the meeting minutes last week. Did anybody have any thoughts, questions, or modifications that needed to be made to that? I have found it helpful when you send that out to click on that and remember what we did, so thanks for sending that. It's good to.
And it was helpful, like last month, JC noticed he wasn't on the attendance. That's
right.
super helpful if you ever were like, I attended this meeting, my name's in there, so things like that.
Yeah. So any thoughts or statements before we approve it? And unless there's nobody that objects, approval has been granted.
Yay. Yeah, I guess the only other update is just this is our second time having an in-person meeting, and so just reminder to everyone that if you would like your time or your mileage or your lodging compensated for traveling to these meetings, we have a system set up to do that. Basically what you'll need to do is send me a W-9, and then I'll send you a survey to fill out what exactly you need to be reimbursed for. But that is always an option, and we have quite a lot of budget for that. So we want to make sure if people are able to travel, don't let finances be the reason that you don't come to an in-person meeting.
Excellent. Thanks for all the coordination with the food. Lunch was great, and
Yes,
the
yes,
room,
it was so easy. It was so
This
easy.
was,
I should have email.
this was great, and this worked out super.
And then, as a reminder, the subcommittees, be sure to coordinate when you're meeting, because we do need to post that on our website, because it is a public meeting. So we need to know in advance when subcommittees are meeting, so we can post that information. So be sure to include that.
Yes. Oh, yeah. No worries.
And we didn't really give a expectation for how often the subcommittees meet. Do we want something like to say to meet at least quarterly?
So I can just speak for the data one, is that we were just kind of like, let's just base this around what's functional, like where we've developed goals to like, we're gonna complete this by the end of the year.
Yeah,
But then rather than being like, we're gonna meet every 2 weeks or whatever,
yeah,
like we've specifically decided like, we're gonna meet based off of the workforce.
based on what you're doing. I like
Yeah.
that.
Makes sense. Yeah, and also committee chairs, if you could keep in mind, we'll really need your assistance when we develop the final report for this.
Yeah,
So we'll be reaching out to you to help us with your portion of that, submit in our final report.
Yep.
And that'll be really important because that goes to the legislature, so.
yeah, the actionable stuff.
Yep.
Excellent. Okay, and I feel like there was something. Oh, that's a follow-up with you. I'll write it down.
And then, just so you know, as you know, I'm ag water policy advisor, so I try to sneak in behavioral health wherever I can. And so because of that, and thank you, Chad, it's after the Gunnison Basin Roundtable meeting in November, the chair of that meeting has decided that this is important, and we're gonna have a screening of the film Legacy after the roundtable, and then Chad will be there, and Julie, we'll get that information to you and see if you can be there.
It's awesome.
So we're trying to interject it in other, but I think that's really critical too, is, you know, some people may not come to a behavioral health meeting, but they're gonna come to a water meeting.
That's right.
And so you capture them when they're there.
Love it.
Good thinking.
I was at a meeting and I can tell you that he did plug, he did that.
He does a good job with that, doesn't he? Yeah.
Good job, Robert.
Trojan horse that. I mean, all right, today we're gonna talk about mental health.
And water.
Here for water.
Okay, then, any public comments or, feedback from anybody, on today's meeting? Things that, you brought that you would want us to consider before the next meeting? I guess feedback for those of you who, weren't able to make it. Did we talk about the next location for, our next in-person? We talked about doing it someplace on the western slope.
Yeah, or we talked about maybe combining with the summit.
Or combining with the summit and trying to do it in Monte Vista. Okay. Well, just keep that in mind, that, the next time we'll try and get closer to you guys' side of the, state. Richard and Julie, thanks for joining, and Tim, despite your, absence, I hope you had a celebratory day there, celebrating 75 years. Thanks for, joining us as much as you could. I know that was a big day there at the, Farm Bureau.
Yeah, and like Julie Drake was mentioning, if anybody here knows of conferences or something that would be great for us to be at and attend to talk about what we're doing, don't hesitate to reach out to Rosie and I, so.
Yeah, as well as updating on any events that are behavioral health events that we can promote.
Yep.
Nice.
So like Colorado Farm Bureau would like us to be there to talk about this. Maybe somebody at Colorado Farm Bureau could squeeze us into the agenda. Yeah, Colorado Farm Bureau. I don't know if anybody at Farm Bureau.
I'm just helping.
So there
But
is
yeah.
a big conference coming up. Unfortunately, it's right at the end of our forum in October, but a lot of the health providers from the western part of the state attend. I think this is the third one. And I will get some information to you guys about that. So maybe someone can attend. If I'm going to try and come back from forum and make it for at least a Friday, but if not, then maybe one or two of you guys would like to go. So I'll get some information about it sent to
That's
you.
great. Yeah, great.
All right, so that's the last thing, is what's going on in your community.
Also, I'd like to follow up a little bit more on JC's conversation.
Yeah.
Since there's funding capabilities, I wanna have a better understanding. I mean, do you guys understand the whole Basso thing and what's? how we can engage people engaged here to access some of those funds?
You know, I'm guessing that Megan Shelton would be the one that we should invite to talk more about that, because it does sound like they're the holder of those.
Yep.
Those funds. And
Good point.
yeah,
Yep.
I think she said she'd be able to attend again in September. It sounded like she was off this one and in August.
Well, I don't know.
I just remember that email that she said, I thought she said, I'll see you in September.
Okay.
I would definitely agree. That would be a good agenda item for the future. This
Yeah.
was more than I learned more today than I've heard the term, but
Amen.
so, yeah, look at the function.
And your point of view too, like that was like, whoa, I needed to hear that. You're right, different world. Now I know what to ask my interviewees.
Yeah, because I did attend one of the BHA open houses that they had.
Yeah, I did too.
And it was nothing what I expected. It was more local providers kind of protesting
That's right.
this whole, what's happening with fossils. And I was,
It was in Larimer County too.
it was shocking to me.
Well,
So,
and United Health is pulling the strings. Like,
Right.
it's very sketch that for it to be concentrated in only 4 areas. 4 holders, 4 gatekeepers.
so we need to learn more about it. So
That'd be great. Yeah.
definitely highlight that, Megan. And Megan really does want to get engaged. She just, with the transition with Kelly being gone now, and with this new program, I know she's pretty overloaded, but she said she's committed. And then Clinton's gonna follow up with her as well, because there was funds dedicated for, to support this project, which Kelly was really working on, I think. So we want to really follow up, see what's gonna happen this coming year. Okay, Megan Shelton, underline, exclamation mark. Thank you. Any other things that we should consider for future agendas? It was great to hear from Maddy this time. Any, projects like that people know about, don't hesitate to let us know, and we're happy to reach out to them. And people are really willing to share what they're doing too, which is cool.
Absolutely.
You don't realize how many efforts are out there. It's, I didn't know there was that many efforts out there, but there are. That's
Coming together, guys. Maybe we should talk about mobile serve too. At the summit, be an agenda item.
Like food.
Yeah.
That'll be up to RMFU to capture, but I'm guessing if you have recommendations, they'd be happy. It's kind of dependent on where they're gonna be at. If they do stick with the
Probably
guy.
potatoes. Potatoes, it'll be potatoes for sure. Come on, this time.
Lamb,
South Dakota.
potatoes and beer.
Stop it with the hot dogs.
No. The Rocky Mountain, Southern Rocky Mountain Ag Conference usually has pretty good food, so. Okay, what else, Rosie or Robert, do we need to address? Please read Rosie's email when it comes out. There will be lots of important links on there. If you know anybody else that is on this committee that hadn't been able to be at one or more of the recent meetings, reach out to them. I've reached out to a couple of them, but it'd be great to have people's interaction, particularly as we're moving towards planning and contributing to the summit and our next in-person event. And that's all I got.
I think, were you coming to the email from Carlyle about JC's replacement?
No.
Possibly including them on the work group. I'll see if I can find it.
Wait, JC's replacement at,
From that area.
oh,
Or reach out to Hannah Bates. She's been doing tons of outreach. She's a fantastic champion advocate for ag and public support. So she worked with JC at Coffee Break Project.
Okay.
She's a comment trainer. She's done all sorts of stuff. She takes like care packages. She'll drive around, stop her truck, get out, run up to someone in their tractor and give them a little care package.
Oh,
She's awesome.
Fowler.
Yeah.
oh my, that's
Who's
gives me
this?
goosebumps.
Hannah Bates. She's over in the Rocky Ford area and was part, there's a lot of staffing of the Coffee Break Project over there, so. She's pretty awesome. And knows everyone in that whole area, so. words related.
Yeah. And thanks to you guys too again for doing comment training at Department of Ag.
Yeah.
We really, really appreciate it. So we're gonna line up for that to happen at CDA again sometime and then
Super.
we really appreciate it.
Thanks for the invite, guys.
Thank you so much, Tony.
Thanks
Safe
for coming,
travels.
Tony. Thanks for all you do there.
Thank you.
I will, next time I see you.
Yeah, yeah, right. Take care.
See you, Jake.
All right, I don't have anything else. Yay.
Okay, stop recording.
Oh, yeah.
Oh my God, it would be.
Thanks, Julie. See ya.
Thanks, bye.